Hello, everyone, and welcome back to Undoctrinate Yourself. Today, I'm sitting down with my very good friend, Aleena Kanner, who's a postural restoration provider and a certified athletic trainer. We've been friends for quite some time, at least 2, 3 years, something like that.
Yeah.
I did some pour painting at her mom's house a couple years ago where I met Elise, who was another previous guest on the podcast. I actually think I found Aleena's work through Rua Gilna, who's also been on the podcast a couple times. So we're in good company here, and I'm really excited to share with Aleena today. She's really working at like the bleeding edge of integrating vision and dental with postural issues and helping to make people feel better and help them to live more pain-free lives and more success with their physical bodies and how that relates to how we can all act in the world in the best of our ability. So thank you so much, Aleena, for coming on. I'm excited to chat today.
Thank you for having me. I'm very excited to be here.
Yeah, it's good you made the trek down from New York. It was like, what, two
It's
hours?
2 hours. Not
Not too
bad.
bad, pretty painless.
Not bad.
You
And
made
I
a new
get to spend
friend
some time with
with
Wiley.
Wiley, new
So, really
friends.
good.
Great. Yeah. So, I mean, maybe you can just give us a little background of how you got into this work to begin with. And then we can start going into some of the details around the topics that we were thinking about talking today as it relates to dental vision, cataracts, LASIK, getting all into all these juicy topics that people like to hear about.
Yeah, perfect. So, how did I get into this? Honestly, I was in graduate school. I have like a personal journey and then I have like an academic journey that got me here. So, the more academic side is that I was in graduate school. I was working with really high level athletes that, you know, top athletes in the country, helping them with their injuries. And I just felt like these athletes were treated like dollar signs and not like real humans. So they'd get hurt, we'd patch them up, they were thrown back out, sometimes even still fractured. And
Wow.
I just couldn't believe that that was sort of the way that it worked at such high level athletics that I didn't want to work in that field after. And I wanted to kind of figure out a way to still work with people, help people with their injuries or help people with their long-term care of what they're struggling with, but without patching them up and throwing them back. So I found a way for myself. I studied something called postural restoration. I've been studying that for the last like 6 to 7 years. And I've been mixing that along with other components that I've learned through my own journey, just through in general, looking at things from a holistic perspective. And with my own health journey, along with what I saw in athletics, what I saw with mainstream media that covers things like posture, it kind of just didn't make sense to me what I was seeing on the mainstream markets, and I wanted to make a new route for myself. So I've been doing this now for a little while, moved to Texas to learn it, and the journey kind of is where it is today, where I have my own business and I help people with things that they didn't even know could be related. So that's probably what we'll talk a lot about today.
Yeah, I mean, that's something I learned a ton when I first started seeing Rua and who like really introduced me to PRI.
Yeah.
I just had no idea that so many things could be related to imbalances in our posture and biomechanics, like the way that we're feeling, our sleep quality, our nervous system regulation, like our vision, how our teeth are touching, and how we're
Yeah.
able to digest food and detox and like have bowel movements. Like all these things can be so related. And so I really just saw that firsthand. Like for myself, I was in chronic knee pain for years, and I always assumed it was like degenerative from being obese for so long, but turns out I was just basically stuck in an extension pattern. And within one session with him and doing my techniques every day, like been out of knee pain now for over 4 years. Like
Yeah.
it never came back. So it's
Yeah.
I saw firsthand like how powerful that can be, and now I send so many people into the PR world because it synergizes really well with the quantum biology stuff and the light biology stuff, and together it can be like just a really potent way to facilitate healing. How did you find PRI?
So I found PRI in graduate school. One of my classmates who was Japanese, said to me one day, he was like, "You're not gonna work in athletic training. You're gonna end up doing this one-on-one thing." And I was like, "What are you talking about?" And I know that he was already certified because in Japan,
Okay.
there's like a whole PRI Japan is a
Oh,
thing.
I didn't know that.
Yeah, they have a whole institute in Japan, and he had
Mhm.
already taken some of the courses. And he just, for some reason, said something to me about postural restoration, and then I checked it out. And I took a course, and I remember being like, this is so much information. And I had to back off of it for a little bit because it was so opposite of what we learned in school.
Yes.
Everything that we had learned was completely different than what I had just finished learning in graduate school. So I wanted to dive into this information when it was appropriate for me. So then I took another course, and then I've been taking courses and now kind of branching out into learning other things like light biology because I feel like what you just said before, there's such a synergy behind everything because it all goes back to the breath, and that idea of the breath is the same sort of natural thing that we should know how to do. And a lot of times people are struggling. The same thing with understanding sunlight. That's something that we should just naturally do. We should go outside and be in the sun, but people don't know. So it's just about getting this information out there.
Totally. And I feel like ignorance is a huge driver in general. Like, if we think also about the connection between, let's say, our posture and biomechanics and like our environments and our light environments in
Yeah.
particular, I think that's something we're going to be doing some research on together coming up pretty soon this year because I think some people would argue that, if your dopaminergic system is really healthy because your light and dark cycles are really dialed in, you're connected with nature, then maybe you wouldn't even begin to develop these postural imbalances to begin with, or myopia, for example, which highly associated with screen use and like reading things right in front of your face. And we see myopia, like I think it's on trend for 50% of people being myopic and over the course of the next couple decades.
Yeah.
And there's a whole slew of issues that come with that, like such as overcorrection and things like that, which you can talk about, and how that affects your body getting in the wrong prescription. But also from a light perspective, most people's glasses are blocking all of UV light, and then we're missing out on that whole cascade of POMC and the endorphin production and appetite regulation, energy expenditure regulation by blocking that light coming into the eye. And so I think, I don't know if you want to share about like the basic pilot studies you did just wearing blue blocking glasses, like a difference that you saw in people's testing right off the bat was pretty
Yeah,
cool.
even with my own testing, we tested my own self out with no prescription on, with different prescriptions on, and with my red blue light blocking lenses. And the red lens was winning the battle every single time.
Wow.
It would override everything. We actually tested out with playing different songs and rhythms and music, which is something that one of my colleagues is doing a really good job of looking at this information. And if there are certain rhythms in the beat, it can be very disharmonious to the brain to have certain like rap music playing
Right.
where there's kind of like a catastrophe of beats instead of it being like 90s rap music where you feel the same beat. And
Totally.
I was consistently able to get into what we call a neutral pattern, which I can talk about
Yep.
with the red lenses on. But also, what you just mentioned was really interesting. You were saying something about like bringing it back to nature. If you look at the tribes in Africa, like I think it's Hadza
Mm-hmm.
tribe, if you look at their palettes, if you look, they're not wearing glasses. They're not having any of these modern day societal problems that we are struggling with.
Yep.
And those tribes are outside in all the time getting sunlight. They're in areas where the UVB is strong. They're also eating food that is developing this really perfectly developed jaw where they all have these wide palates with forward growth, anterior growth of the face. And we're not seeing any myopia problems there. So I think it's something to think about when we think about the modern society and the problems that we're seeing and what might be the reasons for those problems. And you mentioned it, sunlight, food. Those people that are in that tribe, they're not having breathing or postural problems. We're not seeing that because they don't that's a modern day issue.
Yeah.
So,
And I think Weston A. Price's work really hit on that, but unfortunately, I think it was construed as a food only problem when
yes.
they weren't realizing that these people who were removed from their tribal settings and put into more modern settings were not only eating different diets, they were in completely different environments with,
Yeah.
no UV light, no grounding, like just disconnected from nature. And so I think the combination of those things, it's very powerful. But I also think like getting back to those roots and also doing, just exposing yourself to information like this, working with a PRI provider or somebody that can help you get back to a neutral state. It's like so much can change in a positive way over a pretty short period of time.
Yeah, I never want people to come in and feel like helpless because
Exactly.
they're struggling because most of the time these are modern day problems and we have modern day solutions.
Yes.
So a lot of my way of interacting with people is to help bring them back to nature and to help bring them back to their breath and bring them into a place of homeostasis in their body, and I educate on what we're talking about here. And sometimes some people need a dentist, sometimes some people need an optometrist. That's because their problems are a little more far gone than the other person. But we use a dentist, we use an optometrist if it's needed.
Riley's
Wiley's
like, what are
coming.
you talking about?
He's like very interested in the conversation.
He's like locked in, man.
He's so cute. I'm very happy to have my little guest here. But yeah, some people just need the extra assistance, and that's where, my role comes into play, that where I could be that guidance, that middleman piece that allows for that interaction between the dentist or optometrist to actually make sense and actually play out in a way that it should, and not you just going to the dentist and them never interacting with the optometrist, because all these
Mm,
cranial bones and along with the feet and the rib cage and the pelvis, they all need to work um, in combination with each other.
Totally. I mean, the siloing of medicine in general is just a huge issue. Like,
Yeah.
you can't treat one organ system as separate from the rest. Everything is in constant communication with each other. And even in my PhD, we did a lot of work to show like how metabolites are exchanged between organs. It's like a way for organs to talk to each other, and to think that one specialist can just focus on your mouth, and then one on your eyes, and then one on the. It's also just weird that like the eyes and the mouth are separate from medicine in
I know.
general.
Well, they're very separate from medicine, right?
Yeah.
Insurance is it's separate insurances.
Completely. It's weird.
It's
It's like, is it not
wild.
part of the body? Like,
It's pretty
and
wild.
they don't talk to each other. Like, I actually had that experience firsthand with like the specialists that were dealing with my mom when she was in the hospital. It was like none of them were talking to each other.
They
And then
don't.
the family of, let's say, the patients have to deal with all the chaos and try to advocate in this space where it's like everybody's saying conflicting things.
Yeah, and it's also and that acute scenarios that really happens like in a hospital, right? And then you're dealing with it and it's chaotic right in the
Yes.
moment. And then it's also chaotic on the other way is that where I see people in chronic pain. So they are like very stressed out that they've dealt with this. They know what it's like to have to advocate for themselves, but they're so burnt out because they've advocated for themselves for the last 10 years
Yeah.
and they feel like they've gotten nowhere.
And they
And
get gaslit half the
yeah, and
time.
that's a huge thing.
Yeah.
The gaslighting in the industry is just ginormous. It's a massive problem.
Yeah, I mean, especially when it comes to the line of work that you're doing, it's like that's really an N of one approach. Like, you're dealing with an individual
Yeah.
person's imbalances, issues, traumas, whatever it is. But like medicine is really focused on the average response across the population, and you can't do the work that you do within that paradigm. It just
No.
doesn't work.
No, and even if the average response is an okay response to certain surgeries or treatment options, great. I'm seeing the people that are not in that
The
average.
outliers.
Yeah.
Yeah.
So, and then they're really suffering. And so I just want to be able to help get the information out there so more people can know about it because if a doctor comes across this, let's say, and they hear, oh, wow, the dental occlusion system could have a real significant effect on my patient's hip, and then now they know this information, then they're more likely to share it and talk about it. But if they never know about it, they're way more likely to gaslight their patient.
Totally.
So that's where I think it's really powerful to be able to talk and share.
Yeah. And also, another thing about like modern solutions, I feel like when I've really thought about the concept of progress in science and medicine, on one hand, people may say, okay, like, we've made a ton of progress, we understand so much more. But on the other side of that, I feel like, let's say 90% of our innovations have been made to deal with problems we created unconsciously,
Yeah,
basically.
that's
So it's
for
like,
sure.
is that innovation really? I don't know. I don't
I
know.
know. I agree. A lot of solutions to man-made problems.
Yeah, exactly. So, I mean, maybe we can start getting into some of the details. You want to start with like vision or dental or whatever makes the most sense,
Sure.
or maybe talk about neutrality first and what that even
Yeah.
means within the PR lens, and we can go on from there.
Yeah, so the way I like to explain neutrality is that you have a right half of your body and you have a left half of your body and you have an in between. And that in between is what happens in a gait cycle. So when I say gait cycle, I'm talking about walking. When you walk, your body has to operate on its right leg, it has to shift to neutral and then operate on its left leg. And when I mean by operate, I mean it has to be able to organize each and every piece properly over each half. So when you stand on your right leg, your right hip has to be ever so slightly back while your left hip has to be forward. You have all these little components happening at different areas. So I just explained the hip, but what about the cranium? So we have these little cranial bones that have to move to organize properly over the right leg and then left leg. Okay, so what we see a lot of times is because of the organ placement in general, where we have a liver that's 3 pounds on average on the right side, we have 3 lobes of lung on the right side, 2 on the left, and we have a diaphragm that is bigger. The hemidiaphragm on the right side is bigger than it is on the left side. It has a stronger pull, it's attached low into the lumbar spine, and it is a very significant mover in the way that the body is orienting and operating. So we'll typically find that people will end up being more dominant and pulled over onto their right leg, meaning that they organize themselves easier on that right leg than they can organize themselves on the left leg. That doesn't mean they never get to that left side. That just means that they might have a preference of being over their right leg for majority of the time. And what we want is the ability to go both right side and left side. And we want the person to have a nice homeostasis and a nice rhythm and a flow. And when we're missing that rhythm and flow is when we see issues arise. So essentially, my goal when somebody comes in to see me is first off, test them. Where are they at? What are my objective tests saying about that person? Are they really oriented over the right side? What is their cranium telling me? I'm looking at every single bit of the puzzle. I'm not just looking at one thing because you can't get a full picture of somebody if you're only looking at one or two tests. So I do all my tests. I see where that person is orienting the majority of the time. And then I am giving them specific techniques to help what we call reposition or change their orientation in space. We're changing their center of mass. We're changing how their brain essentially understands their environment. And then we can get to a state of neutrality. And neutrality, Wiley is really into this conversation.
You're done. Vanish.
Bye, Wiley.
Fun. Uh-oh.
I'm dead. That is so funny. It's fine. I don't care.
All right, neutrality.
So essentially, getting to that state of neutrality is going to allow that brain to have optimal function because you're never functioning optimally if you're stuck on one side. You're never using your full brain capacity.
Mm-hmm.
You need to be able to go right, left for a lot of reasons. You want left peripheral vision, you have to get over to your left leg to properly use that left peripheral vision. Your shoulder on the left side has to depress to get over to that left side. So we have all of these pieces of the puzzle that have to move so that the brain and body know how to flow and rhythmically be able to have this what we call oscillation. So when I see patients in the clinic, I'm seeing people that are struggling. So most of the time they don't have that flow, they don't have that rhythm. And my goal is to find out what they need first to get them to get that flow. And sometimes people just need techniques and they're good to go. Like you said, within 1 or 2 sessions, you said your knee felt better. That's awesome. Not everybody is so easy. Some people have visual issues, dental issues, and sometimes we use the dental occlusion system or we use the visual system, even if they don't have issues there, to get their body into a state of neutrality so that they can get pain free. Because most of the time people are coming to me in pain. This patterning that I'm talking about is not a problem if you don't have pain. We see people all the time that are walking around still more hemispherically dominant using their right side, but they have no pain, they feel good, they have no problem. I'm not concerned about it. It's the people that are struggling that I want to be able to help get this oscillatory flow back in place into their system. And that flow is going to enhance even things like tear production. We're going to see vocal resonance be greater. There's a lot of different components here. So we could talk more about dental and vision too, but that's essentially the idea of neutrality. So I hope that
Mm-hmm.
explains that.
Yeah, that makes really good sense. And the thing that's coming to mind with regards to like people who are more sticky or in their patterns, that there could be issues in getting them into their body in the way that like makes them pain free and better performance. And I'm thinking about like neuroplasticity and also an ability to like feel safe in your environment and
Mm-hmm.
safe in your body, and how if you're stuck in a fight or flight state, it's really hard to learn in general and including motor learning. And so it's just always at the back of my mind and ways to help expedite progress for people and
Yeah.
their ability to have these results stick in the short, medium, and long term. And so I think the light environment comes into play again here, because if you're
Yeah.
in an environment, let's say you're doing your testing, or somebody's coming to you, they work a job, they're under fluorescent lights all day long. Maybe even the assessment is happening under fluorescent or LED lights. It's like this blue light toxic environment that's activating your sympathetic nervous system, which is then preventing you from inhabiting more of a parasympathetic state, which is where motor learning even happens. And so I think even in the acute testing phase, but also in like the phase where they're doing their homework at home and like curating an environment that helps them
Yeah.
feel safe, relaxed, parasympathetic, that will expedite their progress potentially pretty rapidly. I'm really curious to do like testing with this.
Yeah, and that's why we're going to do some research on it because it's something that I'm really passionate about too. Because this is not, like you said, medicine can't be siloed. Like, we have to look at every single little piece of the puzzle. When I am talking to these patients, I'm trying my best to educate on these topics because, exactly, if they're in front of fluorescent lighting all day long and they have a very stressful job and they're going home and they're not eating in a way that is suitable, then I can do all the best work in the world. But if their environment is not going to allow them to heal, then there's nothing that I can really do. My best job is to give as much education I can and to give them techniques and guide them in a way that's going to help them. But I also need them to understand that they are a big part of their own healing. because I can't heal people. People heal themselves. And
Exactly.
yeah, the environment is huge. And also what's going on in your head is huge. If your nervous system is going haywire, we could talk about also just extension patterning because like you were mentioning before, this sympathetic overdrive that we see a lot in today's society. I mean, I work in New York. All the people I see are on overdrive. They're stressed out. They have stressful jobs and their rib cages are lifted up towards Mars. And it's because their system, they don't know how to breathe, they don't know how to exhale. And what we'll see on a consistent basis is necks that are overrun by the sternocleidomastoids are pulling the rib cage up and forward, the pelvis up and forward, and nobody can breathe well, or these people that are in the sympathetic overdrive cannot breathe well. Now, are they in that sympathetic overdrive because of their entire environment, their lifestyle? And I personally think it's not a, we have to look at all these pieces of the puzzle. But that sort of extension locks the body up so then they can't rotate. They can't properly get either to the right or the left side of their body. So now they're in a state of essentially panic without no proper oxygen flow. And so we're seeing these things that we're talking about from like a holistic medicine perspective of getting the brain to calm down into that parasympathetic state because you're not going to be able to digest your food. You're not going to be able to learn. You're not going to be able to do anything peacefully and happily if your body is going haywire and we're seeing it posturally. And that's where we can address it from the light environment, from food, from all these other components, but we can also address it through the breath and through teeth and eyes if necessary. So it's like this, there's the same goal, but we can look at it from so many lenses, which is cool.
Yeah, and there's such like a close relationship and like crosstalk between like the mental and the psychological and the physical as well. Like I've shadowed Rua probably for like 50 to 75 clients, like shared clients at this point, and it's not uncommon for people to have like cathartic experiences or
Yeah.
like aha moments when they're on the table or like doing specific techniques and they're finally able to inhabit their body in a way that they weren't able to do that prior. And it's just I think it speaks to the power of well, not only PRI, but just an ability to feel into areas that we may have like closed off or numbed off in holding patterns, like to avoid feeling pain. That pain could be physical, it could be related to a trauma from somebody's past. I
Yeah.
think it's a really interesting area, but so much can be accomplished going through the physical. And I kind of feel the same way about like modulating the light environment, where it's like low-hanging fruit that can give you access to deeper parts of your healing journey.
Yeah, 100%. It's actually interesting as you were saying this, I was thinking about I see a lot of different types of patients and my tougher patients that not that they're tough in general, they can't sense. They're yogis and they're financial people.
Hmm.
People that work in finance because they are just in a brain of only thinking about numbers all the time and they're never sensing themselves.
Mm.
Whereas like therapists or somebody else in the health field, it's so easy to work with because they understand their body, they can feel, and doctors, sometimes physicians have a really hard time sensing their body, which
Mm.
is a very interesting thing because medicine, like conventional doctors, I'm talking about, medicine has, I think, torn them in a way apart from that spiritual, sensual self and feeling.
They're trapped in
Um,
the intellect.
exactly.
Yeah.
And the people that are trapped in the intellect are really with numbers, actuaries, people that are in the financial district, and that's what they do, finance, and they both men and women like they struggle with it. So it kind of just made me think about that, like what you choose to do with your life is going to dictate a lot about your body. I'm going to see it on your body.
That's a
So,
great point. I think the yogis is one that maybe would surprise people. Like, I
mhm.
think people tend to think that more flexibility is good, but maybe you can just dispel that myth here and now.
Yeah, that's a big one.
Yeah.
So, more flexibility is not good. I always feel like I can talk about this because I was a gymnast growing up, so I stretched my whole life and I feel like this is something I'm allowed to talk about and I'm allowed to be ruthless because the more you stretch, the more your brain will shut off the signals to those areas. So, for example, if you can do what we call like a forward fold. If you can easily go down and touch your toes and you can easily palm the floor, your hamstring tissue should signal to your brain, hey, like stop. You have an end range here because hamstrings are going to provide integrity to the pelvis. And when that is compromised or overstretched, there's no end range. Your brain is not getting the signal like there's a pull in the back of your leg to stop you from going so far forward. And what we see with yogis is that they've just lost all sense of a lot of areas, most areas of their body. There's a lot of ligament laxity, there's the muscle belly is just overstretched, and it's because they do in modern day yoga. I'm not talking about yoga from 5,000 years ago. That's a different conversation. Modern day, they're doing a lot of different types of exercises in one class. There's a billion different exercises, and then they're just holding different positions for a long static period of time. You are essentially telling the brain to decrease the connection to that area. So we're not going to have hamstrings that support the pelvis. We're not going to have hamstrings that know when end range is. And I'm just giving hamstrings as an example. We see it in the shoulders, we see it in the neck big time, and we call that pathology. And that pathology, certain people with a lot of extreme pathology on a body that is patterned in extension. So, for example, their rib cage is very, very lifted up, but they can go down and touch their toes. That doesn't really add up. It should not add up. And so, when I see that in somebody, those are the people that a lot of times do need dental and vision because their body sense is lost. So, we have to give them sense from their external environment, essentially.
And I feel like another dangerous part of that is that a lot of people who like, let's say, teach yoga or like are good in gymnastics, they're like self-selecting those sports or those activities because they already have ligamentous laxity, and then
Yes.
normal people come in and they're like, I should be like them, and now they're like basically messing up their connective tissues and their signaling and their sense because they think that's something that you should be like going towards, that that's something to
Yeah.
aspire to.
It's like there's natural selection with athletes too.
Yes.
Like I was a gymnast and then I went into Olympic weightlifting. That's a very common transition because as an Olympic weightlifter, you have to be able to squat all the way down. You have to have that quick twitch and the mobility or flexibility really to get down there. And so a lot of gymnasts become into that sport. But what you're talking about too is you have these yogis that maybe are very good at yoga. Most of them are in a lot of chronic pain, and now
Yes.
they're teaching the general public.
Right.
And it's quite dangerous because you have somebody who's over flexible teaching somebody who does not have that range, and nor should they push past that
Right.
because not when the body is a bit tight, it's telling you where your stopping point is. I could teach somebody how to breathe to get better range, but forcing the body there, anything with force, in my opinion, at this point, anything with force is just generally not the best idea. And
Mm-hmm.
what we do with most surgical procedures is forcing things. So, forcing yourself through pain to force a stretch is really suboptimal for the rest of your system. Like your brain is telling you, it's signaling that you don't want to be here. You don't want to do this. So you have to listen to that because that's your brain saying sympathetic. Like it's a big red stop sign.
Mm-hmm.
So
Yeah, I think a good point maybe for people who are, let's say, hypermobile or hyperflexible and uses PRI and like restores healthy range of motion. It doesn't mean that you're going to lose your flexibility. It just means that your muscle's going to be now signaling to your brain at the appropriate range of motion that, like, hey, we should stop here. If you want to go beyond that, you can still choose to do that.
yeah, you can still. I've worked with contortionists and
Right.
they can regain the integrity of their like essentially their pelvis, their rib cage. They're still going to have that laxity. You're still once those ligaments stretch out, they're stretched. But you can use muscles to support that the bony structure. And that's what we do with what my learning is how do we teach the muscles to really support the entire region and how do we teach the brain when the signals are appropriate versus when they're missing.
Mm-hmm.
So contortionist will still be able to be a contortionist. A yogi will be able to be a yogi, but with less pain. And that's the idea there. And also, like, I never tell a patient, if you love doing yoga 3 times a week, I'm never going to say, don't do yoga. I'm just going to educate you and say, I think that there are other options for you to do and not necessarily force yourself through these stretching positions. There's some strength training that could be similar style to yoga. A lot of people do yoga because they like the meditative aspect,
Mm-hmm.
not necessarily the stretching. Most people do not like holding a static stretch. It's quite painful. I know I did it in childhood. Like it's not the best, but most people are going to these things because they think they're restorative. They think it's good for them. But when you educate them and you explain to them what it's actually doing to their body and how there's other solutions, they're happy to try something new.
Mm-hmm. Yeah, that makes a ton of sense. And I've heard, I think Rue was talking about this, if you put your child or in like a young child in ballet or gymnastics and they're doing a ton of stretching at that age, that can really set up issues for later in life versus
Yeah.
if they started, let's say, as a teen, for example.
Yeah, yeah. I mean, I wasn't as competitive as other people, but I just was stretching since I was 5, and I think that it really lost sense to my brain about certain areas. And so now, as an adult, I've had to go back and really regain that sense using external things. And but I do really agree with him there because the more complicated patients are the hypermobile people, and some people are straight up hypermobile. Now there's a huge like I almost think it's like an epidemic of people getting diagnosed with EDS.
Right. Yeah, it does seem like
It's like
the diagnostic
boomed.
criteria have like widened or something. I'm not
It's
sure.
wild because a
Yeah.
lot of people are coming in, they're like, "Oh, I have EDS," and it's like, do you? Because I've really seen, I saw EDS, I went did a rotation with an EDS case in graduate school of a clinic, and there were kids there. And like these kids are really loosey-goosey. Like they don't
Mm-hmm.
have any integrity, and it's really hard for them. And so I don't know if now we're just diagnosing people with a lot of EDS or, they might see a genetic marker and it's like, oh, for sure, this person has EDS. But I do think EDS is a thing. And I think that the people struggling with EDS also have a lot of lifestyle circumstances. I think that things like UV light are a huge, huge missing link to the puzzle. And I
Oh
think
yeah.
we can do all the strength work in the world, but that's not going to fix the nervous system
Mm-hmm.
that's going haywire.
Yeah, and I imagine like the red and infrared light part is probably really important too because it stimulates collagen synthesis and
Yeah.
supports the connective tissues and the fascia and allows light and water communication in the
Yeah, just
body.
light.
Yeah.
And just getting back to nature, water, all the things that that you educate about that are really important in bringing that person back to closer to their natural self because that these people that are struggling with EDS, it's a sensory problem.
Mm-hmm.
I think it's a brain's inability to fully sense. And I think you can make significant progress if it's done properly, if the body's signals are rearranged.
Mm-hmm.
So,
Yeah, that's really interesting. I know a couple people who were diagnosed with it. Actually, one had her back broken by a chiropractor because apparently she had a congenital
oh
defect in
my
her
God.
spine that she didn't know, but like her like around her tailbone. And then when she got this chiropractic adjustment, it literally broke her back and she was like in a wheelchair for a period of time.
Wow. I mean,
It's
I
crazy.
have colleagues that are chiropractors, and my take on chiropractic care is that it's so dependent on the chiro.
Yeah,
And also, your body's in a pattern and you can't force it out of it. So when
right.
we go and adjust and we do especially like these rapid force adjustments, I think it can be extremely detrimental. I mean, you could put somebody into a stroke.
Yeah.
It's scary.
Yeah, and I mean with manual therapies in general, I feel like that was a big aha moment that I had learning about PRI is that like you should teach the body how to hold its position in
Yes.
in an effective and efficient way itself, not from the outside, because then you don't have the neural patterning that's actually able to keep it there. So you have to
Yeah.
keep going back.
Right. And that's a big thing. Like, I do like some manual therapies, but I do think that people feel so much better after a massage. And then
Yeah,
2 days later, they go back. And
exactly.
same with chiropractic care. And the goal for us as a, postural restoration provider is that you don't feel like that. I don't want my patients to be like, oh, I did techniques and then now it kind of went back. Then I know the body's not holding. I want that body to hold. And that's actually a big key for me. Hey, maybe we need to reroute a little bit,
Mm-hmm.
but or look at other higher level signals that are coming from up above or down below. The feet are a really big component to it too.
Yeah, it's really, I feel like a way of helping people that's very inherently empowering versus like you're hoping they don't need you for very long. Like they should
Yeah,
graduate from your care and go on and live a healthy, pain-free life. If they constantly need to come back and have the same issues, that's like a red flag
yeah,
that there's something not working here.
right, exactly.
Do you want to
100%.
talk a little bit about like so we can talk about dental and vision, but maybe start with the feet. You just mentioned it because I think it's something really interesting. A
Yeah.
lot of people are in terrible shoes. What makes a good shoe? Why are a lot of shoes bad? Should our feet be like if we were like living in nature, and how does that differ from like a modern foot, let's say?
Yeah, yeah, let's start there. So our feet should be like wide and thick and muscular and be able to grip if we are living in nature. But unfortunately, most of us are not. I wish I was.
Same.
Like out in a tribe in the middle of
That'd be
Africa.
great.
Yeah, but we are in modern society, and what we have seen is that shoes definitely have changed the structure of our feet. We're putting little kids in shoes. If you have a little child, just keep them outside shoeless as long as possible. Now, my take on the whole barefoot world is different than these barefoot shoe gurus, and I get a lot of hate whenever I talk about this, but I don't really mind because I know what's correct and
Yeah.
what really matters. Now, when it comes to the exchange of frequency from the earth, I think that that is vital for healing. But we are not walking on flat or uneven surfaces all the time. We're not outside grounding from the actual earth. And if we are, great, we should be barefoot. I live by the beach, you have grass in your backyard. Going outside and grounding is different than what I'm about to talk about. I am a big fan of going outside barefoot and grounding. I am not a big fan of walking around with barefoot shoes or walking around barefoot in your house or just on outside flat surfaces. So if you're working in a city and you're wearing a barefoot shoe to work, that's going to potentially create problems up the chain. And that's because, like I mentioned before, with the gait cycle, we have this oscillatory flow of movement. In the foot, we have that as well. There's all these little bones in the feet that have to articulate with one another in order to get proper full range. And we have the one movement pattern called supination, which is when you're on the outside edge of your foot. We have more of a mid stance neutral, and then we have pronation, which is when the mid part of your foot, the arch, and is able to feel the ground and push off and move forward into the gait cycle. If you don't pronate that foot and you never push off properly, you can never get to the other leg. So that pronation piece is really, really important. We need to have this full range in order to propel our body forward and move through space. If we are walking outside on flat surfaces, we are essentially slapping the ground with our foot. We're never getting this full movement range. We're never getting this oscillatory movement, which yeah, I'm just talking about the feet, but it's going to actually reiterate up into the neck. And we're going to see that the patterns up at the head, neck, and cranium are going to reflect what's going on down below as well. So the shoes that I recommend are typically Brooks and Asics. There's a shoe list. I actually have a free PDF on my
Oh,
website.
great.
So I'll send it to you.
I'll put it in
And
the link in the show
yeah,
notes.
and it just talks about the components of a shoe. So a heel counter, which is the back portion of the shoe, you can squeeze the heel counter and see how much resistance you're getting from it. And we want a strong heel counter because of the way that the foot is structured. We have a bone in the foot called the talus, which doesn't have any muscular attachments. And so the only way to really control where that talus lies is by the calcaneus, which is the heel bone. So when that calcaneus is in a nice neutral position, the talus is in a neutral position, and then we can get both pronation, supination from the rest of the foot. But when we have any sort of serious flattening or serious high arches, that's because the talus position is off. And so we have to control that. We have to kind of push the foot to establish this neutrality, especially in modern day society. So a heel counter is really important and an arch is really important. Today's talk in mainstream media, they talk about the arch as in we're going to put a really big arch here, right? Or orthotics, they put big arches to lift the person's arch up. That's not how I think about an arch. I think about an arch support as a sensory tool for the brain. So that sensory tool for the brain allows for that person to be able to push off, like I was mentioning before, and get to the other leg. Because when there's an arch underneath that, the arch of your foot, your brain says, oh, I feel that. I'm going to press into it and move forward. Without an arch there, which is what you see essentially in a barefoot shoe, it's just flat, your brain doesn't learn supination. I do believe sometimes manual footwork can be very powerful, just to help get that movement going. But honestly, for most people, they could get into a good shoe and be in a good shoe, and they're going to feel a significant difference. And, it's something that you don't have to be in shoe jail forever. But if you go outside on a walk, throw on a good pair of shoes. I personally I'm barefoot at home because I have done the work on my body that I don't need to worry about this. I feel good. I don't have a problem. But for my patients that come in where they have chronic neck pain and they've had that neck pain for 15 years, yeah, I'm telling them to wear a shoe in their house. And we do see significant changes with that.
Yeah, I can definitely attest to that. Before I got into like the Brooks Adrenaline 23s, I was wearing like Adidas, what are the Ultra Boost, I think they're
Oh,
called.
yeah.
Anyway, every time I would go on a walk, I would get terrible hip pain, like
Uh,
terrible. And then I got these new shoes, put them on, no hip pain. Like it was just gone. It was
yeah.
crazy.
And it's funny too, because everybody is a little different on the shoes. Like I love recently the Brooks Go 16. They
Hmm.
came out earlier this year. That's my shoe. I knew when I put it on, I was like, oh, I love these. And I
Oh,
really
so
like
nice.
the Brooks Addiction.
Okay.
And
I've
they're
never tried any other the
they're
Brooks.
oh, well, because you like your shoe.
Yeah.
So you probably stick with the same one. I don't blame you. That's a thing. So like that, and that's good. That shoe probably works really well for you. I recommend that one a lot, the adrenalines.
Hmm.
But everyone is slightly different. And the only way to really know is to try it on,
Hmm.
go on a walk, see how you feel.
Yeah.
And you'll know, I tell people, you'll know when you put the right shoe on, your body's going to tell you. Unless you're sense is very, very skewed, which not skewed off. You know, like I was mentioning before about the people that work in finance,
Hmm.
they might have a harder time. So then I'll test. I can test the shoe with the body and, help the person
Hmm.
make that decision. But most people that are in tune with their body will know what shoe works for them.
Yeah, and when I got the adrenalines, I went to like a running store and they had all the different shoes, like most of the shoes from the shoe list there, so I could try them all on,
Yeah.
which is, I mean, it sounds like that's what you would recommend as well, if you could just try them and see which
Yeah.
feels right. And another important thing I think that you kind of alluded to is that they should feel good right away. You shouldn't have to break them in, quote
Yeah,
unquote.
that's huge. You don't have to break shoes in.
Yeah.
I don't know why we were taught that growing up.
Unless it's like a pair of Louboutins or something that you shouldn't really be
Like
wearing anyway, but I'm gonna
heels.
enjoy them.
Oh my God. Yeah. And that's the thing too. Like it's okay if I go to a wedding, I'm gonna wear heels.
Yeah.
And I'm all for that. That's the goal is that you can wear that and not have pain. I used to wear heels for like 3 hours and have back pain.
Yeah.
And then I went to a conference a month ago and I wore heels for 3 days in a row and
Right.
I was fine. I kept waking up and I was like, is my back gonna hurt? And
Ah!
I'd move around and I'd be like, oh, I'm fine. Because my body has recalibrated itself to be able to handle those stressors.
Hmm.
4 or 5 years ago, my body wasn't able to handle it. So that's where I think people need to understand that this might be a temporary thing that you're in a shoe all the time. And it's also about getting over this hump of like, we need to be barefoot in a barefoot shoe. Like you were joking with me earlier, you asked about my boots. I wear barefoot boots because a company sent them to me, but also I put an insert in there so that there's a little bit of a heel counter and there's an arch support.
Hmm.
And my followers will probably laugh when they hear that I can do that. But I have made those shoes fit me better
They are
because
cute shoes.
they're cute. They have a really nice wide toe box.
Uh-huh.
It's crazy because the barefoot shoe gurus that have made these companies have done a great job with the toe box.
Yeah.
And unfortunately, the shoes that we look at, the Brooks and Asics, you have to get wide. You have to like struggle with it, especially for somebody with a wide foot.
Yeah.
But there really have not found a shoe on the market that encompasses every single quality that
Mm,
I
we need to
love.
do it.
I
Just do
know.
it.
The shoe
A
market is
grounding
tough.
perfectly
A
like
grounding shoe, like
supported shoe
there's nothing like
would
that.
be great.
I know. I've talked to
Make
one
that
company
happen.
about it and it was like, it's so difficult, but I'm sure it's possible.
It's totally possible. I think there's a big market for it too, just a matter of educating people on why it's important,
Right.
and I think it would be a really good add
Oh,
to
it
the
would help
market.
people
Yeah.
so much.
Mm-hmm.
People living in our society today, not
Mm-hmm.
people in a tribe in Africa. They're barefoot and they're fine
They're
doing
doing
that.
great. Yeah,
Yeah,
exactly. They don't need it.
right.
So, okay, we started at the feet. Do you want to work your way up? So, I
Sure.
mean, maybe we can talk about like some common patterns you would see in general and
Sure.
how that relates to the positioning of feet, neck, rib cage, pelvis, things like
Sure.
that.
And then we'll get into the nitty-gritty of the vision and dentals. But
Yes.
we do see a lot of, like I mentioned before, about the way that the body orients typically more over on that right side because of the orientation of that right diaphragm and also really our brain. Our left hemisphere controls the right side of the body, but we have the right side of the body is more dominant on the majority of people, functionally cortically more dominant. And even if you're a lefty, lefties can be tricky, but lefties are still more functionally cortically dominant with their right side. That's why
Hmm.
lefties can still use their right hand.
Hmm.
People that are ambidextrous are the most complicated, to be
Hmm.
honest, because they don't have a dominant side, so their brain never chose dominance. And we'll see a lot of issues with the visual pathways being skewed with people that
Hmm.
are ambidextrous.
Interesting.
Definitely by far my hardest patients.
Hmm.
Most interesting patients, very, very smart people,
Hmm.
but they have a lot of brain pathways that are off.
Well,
So
that's
that's
interesting because I was actually ambidextrous for a period of my childhood because I
mm,
broke my right wrist when I was like 2 years old.
so you're forced
I'm
to use
forced to
your
use the
left.
left, exactly.
That's
And then
interesting. But
and then
after
certain things like
two,
if I'm throwing a frisbee or like batting and like baseball, I do the opposite of what you expect a right-handed person to do. It's weird.
that's interesting.
Yeah.
Very interesting. A lot of times we'll see the ambidextrosity like align itself with a visual problem. So the
Hmm.
kid will have some visual problems and they'll like really not be able to choose a dominant. So yours is more of a force thing.
Yes.
So that's probably actually better because your brain just had to use the other side a
That
little
makes
bit
sense.
versus somebody who is truly, truly born ambidextrous. They cannot choose
Wow.
a side.
Do we know what causes that?
I think it's a missing issue. Like it's in the brain
Mm,
from I think it's you're supposed to know in utero, really. I
right.
think it's like 6 months in your utero. I don't think they know exactly
Um,
the cause, but I personally think that there's a mismatch in the brain, in the hemispheres, as to what the dominance patterns are.
so interesting.
Yeah, and their primitive reflex testing will be off too. Like there's a lot of layover with other issues.
What are
But
primitive
primitive
reflexes?
reflexes are reflexes that help you essentially survive your first year of life and get out of the birth canal.
Okay.
So like the
Oh,
startle
the mammalian
reflex.
dive reflex, is that one?
Yeah, which one?
The mammalian dive where you like gasp when you go into cold water, is that one?
Yeah,
I think it's
yeah.
just when
I
you're
don't know if
coming out of
that's
the birth
primitive, but
canal.
that's maybe
Yeah,
then.
because like if you're being born into water, which we commonly were, I guess,
You're
in the past.
right.
So I think it's one of those
And people
maybe.
still are born
Yeah,
into water.
totally.
It's
The best
really,
way to do
really
it.
badass, to be
Yeah,
honest.
totally.
So awesome. Yeah, no, so there's like Moro, which is like startle reflex. It's
Okay.
like if you drop a baby, a little newborn like this, or like basically I'm gesturing like just lowering a baby down kind of quickly.
Uh-huh.
They'll do this with their arms. And so
Mhm.
that startle reflex, if it's never integrated properly with the brain, it will stick with somebody and they'll have
Okay.
a startle when you clap near them or something like that. So that's one. There's also ATNR, STNR. There's all these other ones that have to do with the brain being able to see different things on both hemispheres. And
Mm.
there's what else? Moro, I said.
That's so interesting. I don't know anything about
Spinal
this.
galant reflex. Yeah, it's really, really fascinating. But they'll really notice that the people that are ambidextrous, their primitive reflexes will be retained. And sometimes what we do in modern society with things like swaddling babies can
Yeah.
actually be problematic with the
Oh.
primitive reflex. There's a lot of controversy over it.
Oh, interesting.
Yeah,
Huh.
it's fascinating
Are these
actually.
people typically on the spectrum?
The ones that have
Like the reflexes
reflexes that are
retained?
not, yeah, retained
Yeah.
reflexes, they can be for sure. They'll be on the spectrum, or they could just be a kid with like dyslexia or
Right.
bad handwriting.
Oh,
So
yeah.
you have the palmar reflex, babies will grasp your finger.
Uh-huh.
That's in case they fall,
Oh,
so to grasp in
that
the
makes
first year of
sense.
life. But if that palmar reflex is not properly integrated, then their ability to write will be it might not be as optimal as if they had
Wow.
integrated palmar reflex. But most kids have their palmar and Babinski reflex. Most kids are fine with
What's
those.
Babinski?
Babinski is when you stroke the bottom of the foot and
Ah,
it will
yes.
come in versus out.
Got it.
And you can integrate these reflexes as kids get older. You have to give them a lot of stimulation to these
There's
areas.
a ton of nerves in the hands and the
Yeah,
feet. Yeah.
huge. And so if it's not, most of the kids, a lot of them are autistic kids, or they
Huh.
do have other issues, social issues,
Right.
anxiety, OCD. These other things can pop up. I took one course in primitive reflex testing. I'm going to take another one because it's really, truly fascinating.
And is that useful for testing anybody or only
No,
children?
you can test adults.
That's very interesting.
Yeah. I've tested some of my friends. I
Hmm.
haven't like gone deep into it, but
Okay.
I feel like I should.
Yeah, I think that would be an interesting tool in the toolkit.
Yeah, now you're like, yeah,
Yeah,
I love
test me
these
after this.
conversations because you're really
I'm
interested.
curious. Yeah.
Yeah, no, yeah, I could test you.
Yeah, that would be
We
cool.
need a paintbrush.
Yeah, exactly.
We'll
Oh,
find
okay.
one.
We definitely have one of those. I was just thinking, I remember whenever I would go to the doctor as a kid and they would do like the reflex testing on the knee,
Yeah,
I would always feel like it was a challenge to like prevent myself from doing it because
but
I'm like,
you
I don't
can't.
want to be controlled.
Oh my God. That's
It's so
literally,
neurotic.
that's what you thought,
That
little
was my thought.
Alexis?
Yes, I was like 6. I was like, you're not gonna control my body.
That's hilarious.
And
But
I was
you
like,
can't
dang it.
control it. It's a
I know,
reflex.
I know. The challenge.
Oh my goodness. Yeah, no, you don't have a
That's
choice with it.
funny.
But yeah, there's a bunch. I can pull up my course after I have
Cool.
some information on it.
Cool. Yeah, so maybe some common patterns that you see
Yeah,
in
so common
PRI.
patterns in PRI, and it will coincide with these reflexes too, but we'll see bodies that are locked up, what we call sagittally, which is basically like similar on both sides. It's more symmetrical. So we'll see that rib cage on both sides will be flared and pelvis on both sides will be dipped forward. And what we see by that is the inability to rotate side to side because think of if you're lifting upwards, your chest is up towards the ceiling, and now you're trying to rotate, you're not able to.
Hmm.
In order to rotate, you actually need your rib cage to come down and in into something called internal rotation to get full range of motion rotation. And what we need to have when we walk is the ability to rotate our thorax, our sternum right to left. So we do see this extension based pattern, very forward on both sides. Body weight is coming forward. People will have all their weight in their toes. People will be utilizing all their neck muscles to essentially hold their body up. Their hip flexors, their calves, and their back will just be tight and working all the time instead of what we call grounded, being weight back in the heels, allowing the pelvis to kind of dip under into a posterior pelvic tilt, allowing for the rib cage to come down into internal rotation. And we will see this lack of groundedness with that extension pattern. We kind of call it floating away
Mm-hmm.
because their whole body weight is coming forward. Their center of mass is forward, almost outside of their system.
You're
So
basically just falling all the
they're
time.
falling forward.
Yeah,
Yeah, you're
that was
falling.
me, by the way.
You and so many people
Yeah,
too.
yeah.
And then we'll also see, so we see that where it's happening on both sides, and underneath that, on everybody pretty much, is that it's always happening more on the left side. So we'll
Mm.
see the left rib cage ever so slightly flared more than the right, left pelvis coming forward. So more weight coming forward on the left and more weight is back on the right. And that's called more of what we call like the left AIC or being more over into your right side.
Mm-hmm.
And so that pattern,
What does AIC stand for? I always wondered that.
anterior inferior chain. It's
Okay,
a chain.
got
It's
it.
like PRI has coined these
Makes
terms,
sense.
but essentially it's just that the body weight is over on the right side.
Okay.
And yeah, PRI did a good job really coining these terms and creating patterns out of it to understand it. Like there's nothing really wrong with that AIC pattern being over on the right leg. We just need to switch it off and go to the other
Can't
leg.
be stuck there. Yeah.
Right. We can't be stuck. We can never be stagnant in
Yes,
life.
yes.
That's like the biggest thing. Like I explain it like there's sun and moon and there's midday. We need to be
Light and
midday
dark.
to get to both.
Yep, exactly.
So these patterns can really dictate how someone's living their life and why they're in pain. And I see a lot of problems with people coming in when they're in the extension based pattern. And I also see different problems, but a lot of problems coming in when somebody has one side really turned on. So these are more of the people that are going to be like, oh yeah, I have all my injuries on my right side,
Mm-hmm.
or my right knee hurts versus like both knees are hurting. We might see a more bilateral problem. It's not always like this, but most of the time.
Mm-hmm.
So underlying every pattern where I see a symmetrical pattern, we see this underlying asymmetry. So I'm always treating the asymmetry.
Mm-hmm.
And with the cranium too, we see these patterns occurring at the cervical spine and the cranium, and that's where it gets more into the visual system and into the dental system. Is really when this pattern can't be retained, like I can't get the person out of it. I'm trying my best. The person's consistent. They're in a good shoe. They're doing everything I've asked,
Mm-hmm.
but they're coming in every week or not every week. I see people like once a month
Mm-hmm.
usually, but they're coming in every month and they're still stuck. Their pain's not going away. And that's when it's really time to try something different and look outside the box.
Mm-hmm. So it sounds like you're kind of starting at the bottom and then going up to the dental and the visual if you have to.
I try. Sometimes it's clear as day if somebody
Okay.
has a dental or vision problem, and then
Right.
I just go right there. And
Okay.
that's just through experience now at
Right.
this point that I can tell. And I don't typically do that, but if on a first session, if certain things are checked off, LASIK eye surgery, that's one.
Mm-hmm.
If that's checked off, I'm not always running to an optometrist, but I only give it 2 or 3 sessions and then I go to an optometrist. That's the way I practice. That's not how other providers practice. Some other providers will do 6 months working on something, but I have seen too many cases of LASIK, for example, or crossbites, dental wise, that are just very, very difficult. And I don't want to waste the person's time and energy. They've already come to me after seeing 4 or 5 other
Yeah.
providers. I want to be mindful of their financial situation. And I also know at this point, like when they need what they need.
Right.
So,
And it's also you valuing your own time as well, because if you
yeah,
know you're not going to be able to make progress with them until they get these other boxes checked, then it just makes sense for that to be,
yeah.
an earlier move versus a
Yeah,
later one.
right. So, yeah, so we can get into all that stuff too.
Yeah, we should. I just want to circle back briefly to
Yeah.
the idea of being grounded
Mm,
neurologically or like physically and also electrically, because I just think there's a really cool relationship there, like
it's
with
the
the
best.
terminology, and I feel like they're both so important. And like you can be grounded electrically, but not grounded in your body, or vice versa. So it's important to be grounded wholly as a whole being.
Yeah, I remember when you talked about this before, and I was like, oh my God, Alexis said this so well. And it was about this specific topic because you understand it.
Mm,
So that introception you have about understanding postural restoration is really cool because you can talk about the grounding through the electricity, like that electrical current from the earth,
hmm.
and you get the difference between that and the physical groundedness.
Totally.
And I don't think everybody really grasps that. And that's
Yeah.
something that I think if it could be more mainstream would be amazing.
Well, yeah, like for example, Rue and I have a shared client. We just had a session with her last week, and she had like a very cathartic experience before we even started. Like, she's very high performing, like takes on everybody else's stuff and never has anybody to help support her when she needs to just like vent or whatever. So she had this whole like, breakdown basically, which
Yeah.
was really good because she was all parasympathetic going into the exercises. And by the end of the session, she described basically feeling like she inhabited her body for the first time in like recent memory.
Yeah, that's
And that's
crazy.
that's really what being grounded is. It's like you're fully inhabiting your body and it feels like you're rooted. You're not
Yeah.
flighty. You're not, and like feeling like you're unstable or like you're just like energetically diffuse, let's say.
Yeah, no, it's you're really on it with that. And that patient, it's interesting. I remember learning this about the term interoception. It's I know what you're talking about because I've experienced this. And people that don't have not experienced this might not fully grasp it, but you get it because you've experienced, you
Yeah.
get what a technique does to your body. You get what the sensations are. So that person, she experienced her body for the first time because that center of mass changed, and then there was also this like emotional component there too. So that's really a key component to healing.
Totally, it's huge. And actually, so I had like I probably still have a little bit of a torsion, you probably noticed in my face. So I've been working on that with Rua for a while. I just keep falling off the boat with my exercises. But anyway,
It's hard.
the first time I did those exercises, it literally felt like I was high, like
Yeah.
in the best way possible. It was amazing.
Yeah.
It was like just a very minor shift, but it just, I had all this energy suddenly. It was just magnificent. And
It-
I feel like, oh, that's actually probably supposed to be my baseline. I'm just like kind of stuck over here in a small deficit that, is kind of wearing and tearing over time. And that's the other thing, like you said, some people are, in these patterns and they're not in pain. Do you think they're really, it's just like a matter of time, or some people will never experience
I
that
think it
pain?
depends on the person. I
Yeah.
think that some people take really good care of themselves from other levels of health. And if you're, eating in a way, I was talking about this yesterday too with Sarah. I did the podcast with her. I know two people in my mind that got their premolars removed. And usually premolar removal for me is like, oh, we have to go probably see a dentist and get you an appliance. But these two people have taken such good care of their bodies for the last 20 years. And because they've taken such good care of their bodies, they have no problems. And I think that it's person specific. I think the majority of people that are in a pattern that have done other things like dental work, eyes, whatever, they're going to have some problems if they've not taken the best care of their bodies. But like the people I'm thinking about really they ground themselves in so many other ways that it doesn't impact them.
Yeah.
But I think there are some things that you have a way harder time like dealing with. Like, your brain can't handle the loss of sense of all those teeth being removed. It's very hard, and as the people get older, they really struggle with it.
Yeah.
So that's yeah, I think it's person specific, but
That makes sense.
yeah,
Yeah, I feel
yeah,
like maybe just one more thing before we move on
yeah,
to dental and visual is just that I think a lot of people are used to having such a low baseline of like
yeah,
energy and vitality that you don't even know what you're missing out on by
yeah.
not being able to experience your body to its fullest potential.
Yeah, that's true. I mean, I can relate to that because I was living in New York and I didn't even know my levels of stress. This was years ago. And then I moved to Texas and I was like, wow, my levels of stress, my baseline levels of stress were so extremely high that I didn't even know I was stressed. Like that
Right.
was just my norm and that was
Mm-hmm.
my lifestyle. And I moved and I experienced going outside every single day. I was on walks every single day and just I didn't even know that I was doing light biology to
Right.
myself. But I would go outside for 2 hours every single
Just
day. It
feels
just like
good.
felt so good
Yeah.
looking at the blue sky, just all of these stressors of my lifestyle back then I didn't know until I got myself out of that environment. And I don't most people don't want to hear that. A lot of people don't want to hear that.
Yeah. It's
So,
definitely the rub.
yeah, like my toughest patients, it's not about what techniques you're doing. It's
Mm-hmm.
about what is your day to day? What is your lifestyle? What are you doing? What are you thinking?
Mm-hmm. I mean, that's why, to bring in astrology very briefly, like the house of health is ruled by Virgo, and that Virgo is really about what your habits are, what you're doing every day, like just habitually, and what's part of your routine, because there's this acknowledgement by our ancestors that whatever you do most often is what's going to dictate your health. So if you're engaging in patterns and behaviors that are breaking you down over time, you're going to run into issues versus developing healthy patterns and habits that are actually supportive to your body, then you're setting yourself up for health in the future. So it's not about the thing that you do every once in a while for your health. It's really about what you're doing every single day over and over again. And the breath
Yes.
is one of the main things. We're
Yeah.
breathing however many times a day, I'm sure you know roughly.
25,000.
Right. So if you're not getting that right at a very fundamental level, things are just starting off at the wrong foot.
100%. It's key. It's key. It's not. It's deep.
Yeah.
I love the astrology component.
Yeah, it's great. And also on that note, you mentioned something about people never really fully exhaling, and I feel like that was a major takeaway I
Mm,
had from PRI is just that like so many people are breathing shallow and so frequently, and when you fully exhale, like I mean, first of all, you can just feel your whole core tighten up. It's turning on all those
yeah.
deep inner abdominal muscles, but then you can feel this sense of threat that comes on by holding a held
Uh-huh.
exhale at first, but the more you practice it, the less scary it feels for your brain, and you're actually dramatically improving your athletic performance by practicing that too, because now your CO2 tolerance is building, which
Yeah.
means that you can tolerate more anaerobic activity. If you're a sprinter or weightlifter or any sort of athlete, really, you can benefit tremendously from that practice. So it's not only about being in pain, it's also a major performance boost for
Huge.
completing
I
these.
mean, look at free divers. Free divers live
Yeah.
extremely long lives. What do they do for their entire life? They exhale. Have you read the book Breath?
Yes, I actually
You should do
interviewed
it for
James
the book
Nestor
club.
recently. Yeah, that's
Oh
a good
yeah,
idea.
I know.
Yeah.
I knew that. Yeah,
Yeah,
you should do that for the book club.
that's
It's
a good
an
idea.
amazing, amazing book. And he looked at free divers and their longevity is unbelievable. And they literally exhale for a living
Yeah.
because and then they pause and they sit in that parasympathetic state and they're able to hold it for an insane brilliant amount of time and it makes sense why their longevity this is why mouth breathing is so problematic and this is like a huge thing in today's society.
Yes.
Huge.
For many reasons. And that also ties in with the dental piece, which we can get into
Yeah.
in a moment. But I'm just thinking to put a little bit of a bow on that, you mentioned like the parasympathetic activity. When you're fully exhaled, that is like the parasympathetic. When you're inhaling, that is the sympathetic. And
Yeah.
so many people are just like
Hyper
inhaling constant,
inhaled. Yep.
hyperinflated.
Yep.
Exactly. Yeah. And so just I mean, just if you do nothing else, maybe just try
Yeah.
doing a full exhale and just holding it, see how long you can hold it, and then do it every so often, see how much you can improve it over time. It's like a short little exercise that can actually give you like pay you back in dividends.
Yeah, it's actually it'll change your life.
Yeah.
That and breathing through your nose are like the
Oh yeah.
two low-hanging fruit in my world. And obviously going outside and being in the light and all that too, but breathe through your nose and learn how to fully exhale and just that half your pain might decrease. And that's a
Totally.
key takeaway from this episode.
Yeah, because when your CO2 tolerance is poor and you're hyperinflated, also you can increase your well, you decrease your pain tolerance. You can be more sensitive to pain.
Yeah.
So that could also, sensitize neurons. So maybe like you said, your pain can decrease, your athletic performance can increase. One thing I noticed, like within 6 weeks of doing my PRI exercises, my back squat went from like 185 by 6 to 225 by 8, and literally in less than 2 months.
Because you're able to pressurize your core.
Exactly.
Like you're able to actually properly pressurize your internal system. And yeah,
Yep.
performance is going to increase.
And I went from doing a normal back squat to a Hatfield squat, which is
Yeah.
just so much better.
Yeah.
Yeah,
So great.
it's so much better. Like, why would you want to get
I,
stuck in an extension position and try to go down into a squat? It's just a
I,
bad idea.
it's so funny because I trained as a weightlifter for
Right.
years and then now I cringe thinking about it. I'm proud of my accomplishments with it, but I'm like, oh my goodness, like I would never do that again just because I know positionally how detrimental it is from even a brain
Oh,
perspective.
yeah.
And I look at every weightlifter I ever trained with, and almost all of them have like issues with anxiety, eating disorders. Like there's issues in it. And
Mm-hmm.
same with gymnastics, to be honest. A lot of it's a positional problem that creates internal stress and strain to the nervous system, and then we see long-term issues.
Mm-hmm.
Gymnasts that are struggling with chronic pain their entire life, but it's not just pain, it's a nervous system regulation problem. That's the big thing that I treat on a daily basis is yeah, you might have back pain or you might be coming to me. I had a patient call me yesterday for dysautonomia. These are nervous system dysregulatory issues. Your brain cannot process what is going on because your body is in such a state of fight or flight. So,
Exactly. And also, if you're doing, like, let's say, weightlifting under heavy weight, there's a ton of, like, sensory information coming in. There's a huge amount of
so much.
threat
Yeah,
under
under fluorescent
under
lights.
fluorescent lights on top of that. So it's just like a perfect storm for
It,
issues and injuries and long-term, nervous system issues as
yeah, it's
well.
funny to me that we use gyms to get
I
healthy.
know.
Like that
There would be a great way to do it. Like, I'm really dying to open up like a
an
franchise of gyms that are all aligned.
outdoor, yeah,
Yeah.
with wooden blocks.
Yeah.
There's so much you
Absolutely.
can do with
Could be
it.
grounded, natural lights, skylights. Like, you can open up the roof, like, or at least get full spectrum lights when it's nighttime if people are going to go in there. You can have red light. Like, there's so much that we can
You
do.
can use a barbell, but you need to know what you're doing.
Yeah. Oh, yeah. Totally. Totally. So I think that's definitely in the future something. I've already consulted like with quite a few gym owners to help them like build out their own facilities in a way that's aligned and work with their professional athletes in a way that's aligned. And so I think there's an immense potential there to help
It's
prevent injury
huge.
recovery and
No one's
everything.
doing this. This is a niche thing. No
Yeah,
one's talking
exactly.
about it. Instead, we have people going to Equinox, spending a ton of money in Equinox for what?
Yeah.
Eucalyptus towels?
Right.
I don't know.
I don't know. I don't know. Like the light environment sucks.
It's
Like there's no
horrible.
grounding. Like it's just
You're shaking because the music is so loud you can feel the floor vibrate. The I mean they're constantly spraying like Clorox and stuff on the
ugh,
windows. The cleaning is significant.
ugh.
Um yeah, there's a lot of issues with most gyms. I'm just picking on Equinox because I used to work there.
Yeah, I'd never actually set foot in an Equinox, but we used to be members at Lifetime. But then I was like, we have most of our equipment here. Like,
You don't need it.
I don't need to go there. Yeah, exactly.
And honestly, less is more when it comes to working out. If
Totally.
you decrease the weight and increase the time under tension, you're going to
Mm-hmm.
feel it, and it's going to be the workout you're going to get is going to be way more significant for your long-term health than if you're just going to the gym and pounding weights.
Absolutely. Like higher volume training, I think is really, I mean, the literature pans out as well. It's
Yeah.
like you just get as good of results and now you're stressing your central nervous system less, your recovery is better, and you can actually move more weight per week.
Yeah, I don't ever focus now on how much I lift ever. And I just lift when I feel like it.
Yeah,
And that took me a long time.
I bet. I
A
mean, since
long
you're like
time.
pedal to the metal for so long.
Yeah.
But at least not, now you have that healthy baseline of muscle. Now you can
Yeah.
just maintain it.
Yeah,
And same
that's
with
how I
me,
feel.
basically.
I don't
I don't lift. I lift maybe like 1 or 2 days a week.
Yeah, that's how I
Usually.
am.
Yeah, I'm not
Yeah.
like obsessive about it.
No, you can't
So it's
be.
good. Yeah.
It's not a healthy lifestyle.
Yeah. And you can get a really like killer workout in with just a few dumbbells and like your body weight. Like
Oh
you can get a
yeah.
great workout in.
Yeah. Oh yeah, and you've done Loa.
Yep, yep. That was
Yeah.
great. Lauren's program
She's
is really
awesome.
wonderful. I
She's
think
great.
the integration of PRI with
So
fitness
cool.
is amazing because
I
there's
know.
like it just helps to like anchor things in as well and just a good synergy.
Yeah. No, I agree 100%.
Yeah.
That's so cool. I
Yeah.
love it.
So you mentioned mouth breathing earlier. I'm thinking
Yeah.
from like a dental health perspective, there's a huge play there because saliva helps to coat the teeth and like an
Hmm.
alkaline solution with minerals helps to remineralize the teeth, prevent cavities, tooth loss, root canals, things like that. But obviously also is changing the shape of your face when you're doing a ton of mouth breathing, which then messes with the jaw. And I'm sure there's a whole bunch of knock-on effects, but maybe we can start talking about the dental integration piece a little bit
Yeah.
and then move up to vision.
No problem. That sounds great. So, what you just said about mouth breathing is really important. Like most mouth breathers have a significant amount of cavities, and they
Yep.
know they do, and they know that it could be problematic. They just don't know necessarily how to change the pattern.
Hmm.
So, people that tend to mouth breathe are usually asthmatic kids. And they maybe had some issues growing up with breathing, and so they just started to breathe through their mouth, and then they never stopped. And then other kids that maybe have had an allergy attack or they had some sort of sickness when they were a child and then they just started one day breathing through their mouth and they never went back. It can happen in adulthood. It's less common, but it can definitely happen to adults. Um, your mouth is your secondary breathing source. You're not supposed to naturally breathe through your mouth unless you are dying for air, like running, sprinting, because you're getting away from something chasing you. That's why we have that pattern. The secondary source. We need it for those sort of sympathetic events. But on a daily basis, we should always be breathing through our nose. Our tongue should be on the roof of our mouth. And that's essentially how we're built. We're built to filter air through our nose so that we're not getting the particles in the air that are harmful. We're just getting the actual quality of the air, even though most of our air today, unfortunately, can be harmful. We need to just filter that out inside with filters.
Yes.
But,
Also, when the air goes past the hairs in the nose, it stimulates the production of nitric oxide, which
right,
improves vasodilation, nutrient oxygen delivery to tissues, and waste removal from tissues, and blood pressure regulation.
it's
It's a
huge.
huge metabolic component there.
Yeah, giant. And if you're not stimulating all that, then you're just bypassing the true source, which is getting it through your nose. You're
Hmm.
going straight through your mouth. Yeah, you're breathing, sure, but very suboptimally. So that's, metabolically what you just said is really powerful. From a structural standpoint, we're going to find a much longer face. We're not going to see so much forward maxillary growth, and you will only get that maxillary growth in children growing. Once you reach like 12, 13 years old, that forward growth is done. That's just, it's not going to be developing. So we need to make sure that we can get that forward growth. And how we're going to get that is tongue position. Tongue needs to rest on the roof of the mouth. Tongue needs to be there all the time. Mouth breathers tend to have a tongue that's going to just dive to the bottom of their mouth. It's going to be a lower tongue posture. They're not going to be ever getting the proper force distribution on the palate to help the palate grow. So we want the palate to grow out and forward. And when somebody's a mouth breather, we're not seeing that because of the tongue position. So that long face is going to contribute to a lot of long-term dental issues.
I just was thinking this people say like why the long face and also
Haha,
people
that's
mouth
funny.
breathing is like an old insult that you would
It's an
say to a mouth
insult. Did you
breather.
remember Hey Arnold?
Yeah, of course we watch it all the time
That
still.
I always think about that guy like I
Mhm.
want to do a meme about
You
him. It'd be
should
funny.
do it. Please do
I will. I'll do it. I'll do
it.
it. But like that guy, what was his? They called
Uh,
him mouth breather, didn't
yes,
they?
yes. I
It
know
was
who you're
a
talking
huge
about.
insult because it was not, you're not as attractive if you're a mouth
Hmm.
breather. That's the insult.
Yep.
That's the bottom line of that insult. So there's a reason for it because a long face is not as attractive as a fuller, wider, nice palate,
Hmm.
a really wide palate face. It's a different look. Um,
It's probably signaling that there's health issues in this person. Don't mate with them.
yeah, yeah.
Yeah.
I truly think that. So and mouth breathers are going to have more health issues. They're not going to be able to filter the air out. They're going to have health issues from a dental perspective because their palates are going to be more narrow. So they're more likely to have dentists and orthodontists say, "Hey, you have a really narrow palate. We want to pull out your premolars. We need to take out your wisdom teeth." And the problem when it comes to taking out teeth is, of course, every tooth is connected to an organ through a meridian. So there's that, which people are always confused about and don't see how the acupuncture, the Chinese medicine really matters. But when you have teeth that are connected to organs, we're going to see if those teeth are pulled, more disruption in those organs, and
Mm,
that's been very true in my practice, seeing people with premolars taken and different their health issues long term.
mm.
So there's that, and then there's also the component of when you take out teeth, you are disrupting the sense of the signals that the brain is getting because when your teeth touch, which is called your occlusion, so one, your top tooth has to touch your bottom tooth, and if they don't touch, they're going to move to find a way to touch. So when we take out one tooth, let's say we take out one tooth, that bottom tooth is actually going to go down to try and meet whatever tooth is not there. So we're going to have shifting of teeth. If we take out all four premolars, now we have a mouth that just became a lot smaller. And so we already have a small mouth. Now it became a lot smaller. Now the brain signals of that dental occlusion are off. And then we have different asymmetries in the dental occlusion that could be problematic. But just talking about the premolars, it can be very, very hard to come back from that. And people don't realize it because they get them taken out at 13, 14 years old. They have problems when they're 35 years old. They don't realize that their neck pain that they've had, herniations in their neck could be very
Hmm.
related. I mean, maybe if it's neck pain, they'll think that there's a relationship, but if it's back pain, they're not going to think about it. And then they come into my office and I asked, that's a question on my form, premolar removal. So I don't want people to feel hopeless if they've had premolar removal or other issues like implants. But what we end up doing is we end up utilizing the techniques. We see if that works for people. We do very specific cranial cervical techniques. Craniosacral therapy could be helpful. And then if that person is not making any progress, that's when I'll reach out to the dentist. And I work with a few dentists in Manhattan right now that will make a dental appliance that is a flat plane splint. And the idea of this flat plane is that it's flat and that it's essentially signaling to your brain to erase whatever bite you have. So if you have a bite that's really off, we're going to give you a more even keeled bite and we're going to disrupt your current signals and give you a more even signal every single night when you go to sleep. So it's not something that people wear 24/7, it's something that people wear to sleep. And it clips in and it's on the bottom jaw. It's not on the top jaw. And the reason for that is because the periodontal ligament, we need that connection. And when we put the dental appliance on the top jaw, it disrupts the connection of how that periodontal ligament senses.
Mm.
So the brain doesn't get the proper
Hmm.
connection. However, most dentists today make these night guards for the top jaw, for the maxilla.
Mm.
So it's really hard to now tell a dentist, hey, we want this for this, we want all these specifications. And then essentially what I do is I go with the patient to the appointment, they get the guard, and we adjust it with them standing. And that is a key factor because you are coming to me for pain. Yeah, we're getting you the appliance for your teeth, but it's not really for your teeth, it's for your body to get neutral.
Hmm.
And so if we want that body to be neutral, I need to organize that person standing because how they walk and how they move in space is going to reflect if they're able to get neutral or not. So that dental appliance can be really powerful in someone's healing. And I've worked with a few dentists. I've worked with some biological dentists to try and make guards that are more biocompatible because I really don't want to be using acrylic if I don't have to. But at the same time, some people, they don't care what the guard is. They just want to feel better. And
Mm-hmm.
if I have a dentist that makes an acrylic guard that does a good job, then I use them. But I'm currently starting to work with some other dentists to, find who works really well with me. Just, I've worked with a bunch. So I've worked with dentists in Texas. I had people call me and get me on the phone with their dentist when they live in Colorado, and I will do it, but I'm at the point where I just really want to work with people who understand what we're doing here because it is a very different approach. It's very different than what people learn in dental school, and it's a hard thing for most dentists to grasp because it's not really dentistry.
Mm-hmm.
I have one dentist I work with. I love her. She'll be like, I don't know what this is. Or this isn't dentistry.
Ah.
She's like a Russian woman. And she's so funny when she says that because she's just very true. It's not what they learn in school. We're not changing the teeth, but we're giving the brain a different stimulus. We're changing
Right.
that, like essentially feedback to the brain, and we're changing that neurological response that the person has in their system to help rewire their nervous system. Talk about neuroplasticity.
Mm-hmm.
That's what we're doing. And that guard can be permanent or not permanent, like long term. Not permanent, it's always temporary,
Okay.
or it can be short term.
Okay.
So it's dependent. I mean, for me, I wear one to sleep. It's helped me. I still wear it to sleep. I've worn it for 3 years. Do I need it forever? Probably not. If I go a couple days without it, I'm fine. But some people who've had premolars pulled, people if they have a crossbite, if they have a major cant, so a cant is when one side of the bite is much higher than the other side of the bite. So essentially, one molar is hitting first,
Mm-hmm.
then the other molars. The teeth are just super off.
Mm-hmm.
And when that happens, when there's a lot of asymmetry in the cranium.
Mm-hmm.
A crossbite is when the bottom side of the teeth, like the bottom jaw is coming in front of the top jaw, essentially on one side or on both sides. So you're seeing usually like a canine coming sticking in front of the top canine. And sometimes they're easy to spot, sometimes they're not. Sometimes they're in the back posterior crossbite
Mm-hmm.
versus an anterior, and those can be very, very hard because they however your teeth are hitting every single day is giving your brain that feedback of where you should be in space.
Mm-hmm.
So that, and then you get the visual system, which is going to be influenced by what your bite is doing. So this stuff can get very, very complicated and very, very individualized.
Mm-hmm.
So
And is it bidirectional as well? Like, can your vision stuff affect your bite and teeth, or only the other
it's
direction?
more that your dental
Okay.
impacts your vision. I
Mm-hmm.
almost always see visual complaints or visual issues when there's a major dental
Mm.
occlusion problem. I don't always see that the visual system impacts the dental, but we do see crossover.
Mm-hmm.
But I will send people to directly to vision, and they might not have any dental problems, and they might just get better with that.
Got it. And is that basically based off of like a history report where you see what kind
History.
of work they've had done and like
Yeah.
go from there? Yeah.
History, pain complaints, but history. My history is huge. I
Yeah.
have to know every single thing that's happened to that person.
Yep.
Like we were talking about earlier, like you need to know what that person is doing every minute of their day. And
Mm-hmm.
he mentioned that he's right
Mm-hmm.
because I need to know. I need to also know what is your history, what happened to you as a kid.
Mm-hmm.
I mean, trauma, of course, I do dive into, but also like what happened to you dentally? Did you have full mouth restoration 5 years ago? Because that's going to really impact. Did you have a cavity did you have an amalgam removal taken out and they took it out poorly?
Mm-hmm.
These things are going to really impact the entire way of your cranium, essentially.
Yeah, and also with regards to like the mouth breathing piece, there's like a huge impact of the Bohr effect there, where basically you're changing the ratio of oxygen to carbon
Yeah,
dioxide in the bloodstream. If you're breathing through your mouth versus your nose, that basically makes oxygen availability go down, even though you've got plenty of oxygen. The pH is too high to dissociate the oxygen from hemoglobin, which means that you're basically going to feel like you're out of breath and have pseudohypoxia, as like Uncle Jack would say, in your tissues because the oxygen's not available because the pH is too high. The way that you get the pH lower is to increase the CO2 in the ratio. And that's why people, when they're having panic attacks, they
breathe
breathe into
into
a
a
particular
bag.
bag, exactly, to get more CO2, to lower the pH, that then allows the oxygen to get into the tissues. And so
Yeah.
just nasal breathing is really, really helpful in that context as
Also,
well.
PRI, the full exhale is the same thing as breathing
Yes.
into a bag. It's
Exactly.
doing the exact same metabolic effect in your body when you
Yes.
learn how to fully exhale. But then the idea is that you learn that and you can transfer it into your daily life without consciously thinking about it. Because now you've worked on that breathing. You have that integrity in your core, in your pelvis, in your rib cage. You don't have to think about it. You just
Yep.
naturally know how to do it. That's the goal.
Exactly. It
So
becomes reflexive
you're
and it's
naturally breathing into a paper
that's
bag.
it. Yeah,
Yeah.
exactly. And so yeah, I think that's kind of the goal is almost with everything, anything that you learn at least, it's like you're making something into your bringing something into your conscious awareness and then it becomes, it's I don't remember the exact lineup. It's like consciously incompetent, consciously competent, unconsciously competent. Like basically
Oh, this
it's
is
going
motor
into
learning.
Hmm?
This is like motor learning.
Yeah,
I
exactly.
learned this
So
in
like goes
motion
into the
school.
background and now it's just running by
And it just
itself.
naturally occurs, and that's the
Yes.
goal. And that's
Exactly.
the same with the dental stuff. So we wear this appliance at night. I give it to my patient, they'll wear it at night, and then after a few weeks they'll be like, "Oh, my pain is gone. Like I don't feel it during the day." And is it because the appliance is resetting them every night? And then maybe they stop wearing the appliance and they still feel better.
Mm-hmm.
That's the same components there.
Mm-hmm.
So that's why it works. That's why it holds long term. It becomes subconscious. Anything that works, I've noticed, is subconscious work. Like even therapy,
Mm-hmm.
and you could talk to Elise about this all day. But the real true work with emotional work with people is when they're able to make changes subconsciously. It's the
Yep.
same with my work.
Totally.
Because you can do exercises all day long, and most chiropractic and PT care in America is conscious work,
Yep.
but it is not transferring over into the subconscious, and that's why it doesn't work.
Yep.
Or maybe it does for 6 months, and then you have another injury pop up.
Yep. Well, the brain has to deem the new pattern to be safe and efficient.
And
So
has to
it's,
like use it and rewire towards
yes.
it.
So
Yeah.
it's also a very big issue of repetition too. It's
Yeah.
not going to happen overnight. You
No.
need the repetition in order to actually lay the groundwork for it. And then if it's deemed safe and efficient, then it can be chosen.
Exactly.
Yeah.
And that's the power of healing,
Mm-hmm.
really.
Yeah, totally.
Yeah.
Totally. So you mentioned about vision related to dental. Let's maybe talk about vision broadly and then talk a little bit
Sure.
about cataracts and LASIK, which are two areas that I get a ton of questions about from like the light biology
Yeah.
standpoint, but let's get into it from your
It's
standpoint
so
and I'll chime in
interesting
as well.
from the biology standpoint. We're going to get into it. I'm
Yes.
excited. So, talk about vision in the first place. Your eyes need to work together. You have two eyes, they have to work together. They have to take one picture, merge them, and your brain has to understand that picture and know what to do with that information. And the problem is a lot of ophthalmologists and optometrists are really not looking at the binocularity of our eyes, which means are the eyes working well together? They're just looking, hey, let's patch this eye, see how well this eye sees. Let's look at the other eye. How well does that eye see? That's acuity.
And during that time, they usually have you sitting with your neck jutted
Uh-huh.
forward.
Yep.
So, that's an aside.
Alexis is on it. No, it's true. So they're looking at only acuity and they're looking at it in a position where your body might be actually altering the testing.
Right.
And what you are doing during that exam is really, really important because it's going to reflect in that exam. So we were talking earlier about if you have a stressed out day, you're on a computer all day, and then you go get your eyes tested, that's really not a great idea
Yep.
because your eye testing is going to reflect what you just did earlier that day. If you were on
Yes.
screens all day long, you're going to
Yes.
have most likely need a higher power than if you were outside in nature all morning and then you went and got your eyes tested. But a big issue is really that ophthalmologists, especially ophthalmologists who mainly look at eye disease when they do what we call refractions, which is what you just mentioned, where you're sitting in the chair and they put the thing in front of your face, the phoropter, and they're saying, is one better, is two better? Ophthalmologists typically will look at acuity. So they're only looking at how well you see.
Mm-hmm.
Optometrists are a bit better. I work with behavioral or developmental optometrists. They have two names for them. There is a website called OVDRA and NORA, Nora and OVDRA, and you can find developmental optometrists through that website that do look at binocularity. They have way more testing. They have way more research behind what they're doing. They do vision therapy. They try to teach people how to get the eyes to work better together.
Mm.
Now, there is an order of operations to this because we just talked about the foot, the rib cage, the pelvis, all before we got to the eyes. And that's because it really is on one of the last steps of things, unless I see modern medicine that has disrupted my algorithm type
Right.
order. But most of the time people need to start at the feet, they need to start at the pelvis, they need to get their body in a better position so that when they go and do this exam they're not sitting there very extended. But we do have this problem of only looking at acuity, not looking at how well the eyes merge images together, and then also what we're doing during that exam. If there's, they'll say lean forward, put your head in this thing,
Yeah.
and you're sitting,
Yeah.
we're not meant to use our eyes seated. We're meant to use our eyes in a outdoor external environment. We're sitting under fluorescent lighting. They
Mm-hmm.
usually shut the lights off for the exam. So
Mm-hmm.
now you're pinpointing yourself to look at one small image
And the
on a
peripheral vision
screen.
is off too,
Your
right?
peripheral's off because the
Yeah,
phoropter's there.
exactly.
So it's really not taking into account how your visual system works on a daily basis. Your visual system works when you go on a walk and you have things passing by. It's called optic flow. Things are passing by your peripheral and you're looking out in space. And another thing here is that we work in a single distance. So we can look up close and we see what's up close, and we look far and we see what's far away. But a lot of times right now we're seeing a lot of multifocal corrections. We're seeing a lot, we don't see as much anymore of monovision. Multifocal is when there's like a progressive, they have more than one correction in a lens. So they'll do it
Mm.
into a contact, they'll do it on cataracts, they'll do it in glasses. So we're not meant, our brain will get very confused with this information because we're not meant to see in three different types of
It
planes.
seems so wrong.
It seems very
What's the
wrong.
justification for doing that?
Convenience.
What? Seems I feel like it would make me so nauseous to have that.
So some people do get really nauseous, and I
Yeah.
think that's amazing that the brain signals to that person, "Hey, don't do this. It's
Yeah.
not good for you," because it's essentially not healthy. Some people do need it like on a computer screen if they want to look at their phone and their
Yeah.
dashboard driving. I'm fine with a progressive if it's used driving. I'm not fine if you're wearing a progressive and you're walking through space. You're going down steps and you have at the lower part of your lens a plus prescription and the upper part of your lens a minus prescription. It's
Mm.
extremely confusing to the brain.
Mm.
And we see falls happen, I think it's like 80% more in older individuals.
Yep.
And that's I truly attribute it to the visual system because think of how
Yeah.
many older people are corrected.
Totally.
Whether they have cataracts or whether they're wearing glasses, they're in a correction. So for convenience, we do a lot of things, I think, in society.
Mm-hmm.
And so that's a big component is the progressives. And there's another type of lens called monovision. If you think you get nauseous from
Mm-hmm.
progressives, you'll get super nauseous from monovision. Monovision is when one eye is corrected to see far away. Yeah, one eye is
What?
corrected to see up close. And
What?
it is ultra
Who
confusing for
would
the
do
brain.
this?
It was more of an old school thing, but it still
Okay.
happens. Yeah, I still have patients. They're usually older in their 60s, but I have a 30-year-old right now
Mm.
with a monovision correction.
Who
And
would
it's
prescribe
like
that?
they usually have ankle instability
Oh
problems. They do it.
my God.
Ophthalmologists do it.
Is
Yeah,
it
they do
is
it.
one eye nearsighted and the other farsighted?
So your right eye, I think, is better for distance, and your left eye is a little better up close. But
Actually,
that doesn't
it's really
mean
funny you say that because whenever I don't have my contacts in and I'm looking at my phone, I always close my right eye
me
and use
too.
my left
Me too.
eye.
That I do that too.
Yeah.
That's really
That's
funny that you do
funny.
that. That's really fun. I do it too right in the morning if I look at my phone and I'm like,
Yeah.
here. But I
What
also
the-
like, yeah, my eyes are opposite of what is technically normal, which is
Okay.
weird. But yeah, I think they do this correction and it's extremely detrimental. I have never
Mm.
seen that's like on my list of you're immediately going to an eye doctor. Like whether you're just getting out of your prescription, that's the first thing. I'm like, you just need single distance vision. That's what
Mm-hmm.
you need. So it's really problematic because those people are suffering, actually.
Mm.
They have shoulder replacements, hip replacements, they have a lot of problems. I
Mm.
remember I sat next to a woman on a plane once and she just started talking to me and she was telling me how has to have another surgery. And then
Oh
I was
my
like,
God.
what are you wearing on your eyes? Just curious. And she was like, oh, this one's for far and this one. I was like, that's
Oh
your
my
problem.
God.
And she was like, no way. And I was like, this was free.
You were probably meant to
I
meet her that
know.
day.
And she was like, I'm gonna
Jeez.
go get out of these glasses. And I remember she emailed me and she
Oh,
was like, because I gave her my card and she was like, I got out of them. I feel so much better. But monovision is actually very easy because they come in. I know exactly what's wrong with them.
right. That's true.
Like it's a very easy situation versus somebody who has nothing in their history.
Yeah.
Then I have to figure out what's in their history
Right.
that they're missing.
The
So
sleuthing.
yeah, so
Yeah.
monovision is pretty wild and it's not as common, but it's still a thing and it's good to educate about in case somebody here,
Yeah.
knows someone or has it themselves. But yeah, the visual system is wildly important to orient yourself in space. Where you are in space is going to depend on how your teeth touch, your eyes, how they understand your spatial awareness, and how all of these signals come in and work together.
Mm-hmm. That makes
So
sense. And I mean, the eyes are technically part of the brain,
they're
so
literal squished out brain tissue.
absolutely.
It's pretty wild.
So when you think about all the postural and biomechanical stuff, I mean, it's a brain issue, or
It's
it's controlled by the
all a brain
brain.
issue.
So yeah.
That's why the mainstream media on posture drives me crazy. Like shoulders down and back, just do this
Dumb.
exercise.
Worst
It's like
ever.
it's just a brain problem. Like
Yeah.
you're not in this hunched position for any other reason than you need to breathe. And your brain is just trying to get you to breathe better.
Yeah. And I mean, when you're doing the shoulders back and down, stand up straight thing, you're shutting off all your breathing through your back.
Yeah, you're
I
not
mean,
getting
maybe
it.
you want to talk about that a little bit on some of the exercises. You're looking for expansion through the back to
Yeah.
show that you're breathing correctly, like
Yeah.
360
Yeah,
degree.
your lungs like actually live up into your chest wall and into your back. And
Yeah.
like all this demonization of not breathing into the chest is wild to me because we need expansion up here. And
Mm-hmm.
that doesn't mean that we need our neck to pull upwards. We just need like 360 expansion up into our chest, into our upper back, our posterior mediastinum. A vagus nerve lies right in between your shoulder blades over there. And so when you're getting that breath there, you're actually stimulating the vagus nerve and you're
Mm-hmm.
stimulating your parasympathetic nervous system to pick up some speed and shut down your sympathetics. So
Mm-hmm.
that's why breathing is so powerful. Even if you're just in a yoga class doing breathing, it's still very powerful for people. Now add a positional component, and wow, you can make a world of a difference for somebody.
Mm-hmm. Do you want to
So
dispel belly breathing real quick?
yeah, belly breathing. Belly breathing is going to force you forward even more. So when you're only ever, first of all, your lungs don't live in your belly. That's number one. They literally live up into your chest. They come down into your rib cage. That's why you have the ribs. They're protecting your lungs essentially.
Mm-hmm.
Um, your belly can rise ever so slightly when you breathe. That's fine. That's normal. But when I'm seeing these people that have massive belly shifts and no ability to move air anywhere else, I know that there's a lot of problems happening here. I know that this person has been taught faulty breathing, has practiced faulty breathing, and their whole center of mass is forward. Because when you breathe only into your belly, your rib cage has to actually elevate into extension. Your pelvis has to dump forward because the air is going forward instead of ever having some pressurization.
Mm-hmm.
So when you learn to breathe into your chest, you can actually pressurize. Your belly will still expand ever so slightly, but your lung tissue is getting the movement. They
Mm-hmm.
say the upper third part of the lungs is the most limited to get air into, which is literally right up here.
Yep.
And
I think that also
that's,
has the highest density of alveoli too, so you get
I
best
think
gas
so too.
exchange there.
Yeah, it's
Yeah.
the most
So it's
important place.
better, actually.
Right.
Yeah.
Even just teaching somebody one technique can be the world of a difference for them just to get air back there.
Yeah.
And getting the rib cage into that internally rotated position instead of lifting upwards is going to change your whole center of mass.
Mm-hmm.
So, and you can't force it. You have to do it through the breath. You have to breathe your way into these positions.
Yep.
That's why this posture stuff, on the internet drives me bonkers because it's all forceful exercises and it's not actually making significant change.
Totally. And as it relates to like some issues that maybe people wouldn't even realize are related to like the breath, including acid reflux and
Mm,
constipation, which are two really common ones because if you're not getting that pressurization as you talked about, you're not actually getting to massage your internal organs with every inhale, and
yeah.
that's going to help with peristalsis, pumping lymph, for
Yeah.
example.
Yeah. Lymph, huge.
Yeah, and if that diaphragm isn't working properly, if it's overly stretched because you've got a flared rib cage and you're stuck in this position, then you're not going to get proper closure of the esophageal sphincter that travels through the diaphragm into the stomach, which can cause you to be burping up acid and food post-meal. So a lot of people, they'll be put on PPIs by the
I know.
doctor. Meanwhile, they just need to learn how to breathe.
I've had some people get off their PPIs
Absolutely.
from just PRI.
Multiple people. Yeah, I've seen that multiple
Just from breath
times.
work,
Yeah.
positional breath work, along with the proper modalities if necessary, if they needed dental appliance, etc.
Yep. I always laugh because whenever I try to not whenever I'm introducing PRI to people like clients and they have no idea what it is, I always like describe it in a certain way that doesn't say the word breath work because people will be like, "Oh, breath work,
Yeah,
I've done
I've
that.
done
It didn't
that.
work for me." I'm like, "Oh my God."
People, you can't, it's like you say positional breathing.
Yes, that's good.
Sometimes that's better
That's good.
because it's like different position, but still, people hear breath and they're like, oh, woo woo. I'm like, just because there's breathing involved doesn't mean it's woo woo. Also, a little woo woo is good for everybody.
It is. But I feel like everybody thinks breath work is like either like Wim Hof breathing
I
or
know.
like belly breathing.
I know. And I think there's some positives to the other breath work out there
Sure.
on the market. Like
For
I think
different reasons.
for different
Yeah.
reasons, not for this.
Yeah.
For what we're doing here is we're reteaching the brain complete neuroplasticity over new patterns, new awareness, new sensory tools. And in that, we're changing the center of mass of the person, just
Mm-hmm.
restructuring their nervous system.
Mm-hmm. And
So,
when you shorten those abdominal muscles by learning to breathe right, you also get better abdominal definition. You look
uh-huh.
more ripped and toned. So it's like, and you get better orgasms. You can hold your pee in. You poop better. It's like, who wouldn't want all this?
It's all good stuff.
All good. Circle back to the eyes.
Yeah.
LASIK,
Oh yeah, LASIK.
cataracts. Let's talk about it because it's two areas that I think a lot of people have questions about.
Yeah, this is a great thing to do this with you because like you have such information about
Yeah.
all these topics. It's so fun to actually talk about this stuff with you. So LASIK from a PRI perspective, you'll talk about all the light biology stuff, but from a PRI perspective, here's what we see. We typically see people that are overcorrected in the first place. So many people come into my clinic, they're wearing the wrong prescription because of what we mentioned before, being forward in that chair, head coming forward, loss of periphery, having to focus on this object in their distance 20 feet away. And so they're getting overcorrected for years. You have to have, I think, 5 years of the prescription being the same before you're able to do LASIK. And so here's what we see. We see people that have actual binocular vision dysfunction that are not tested that get LASIK and they have serious complications. Serious, serious.
Yeah.
There was a Fox News anchor. Do you know the story?
Yeah.
And
She killed herself.
yeah,
Yeah.
she killed herself.
There
She
are a bunch of
committed
support
suicide.
groups online too
There's
of
a
people
bunch of
experience
support.
this.
Yes.
Yeah.
And this is because most people have like a visual dysfunction that went underlying because the testing for LASIK is not invasive enough. They don't do significant testing. They're not doing the testing that my optometrists do. They just check how well do you see? They dilate your eyes. Okay, let's do LASIK.
Mm.
So there's not really enough precursor activity before we go and do this
Life-altering procedure. Yeah.
life-altering procedure.
Yeah.
Like you're changing the shape of your cornea. Like it's wild to me, especially now the education I have on it. It's
Totally.
wild. But it's all done for convenience. So people don't want to wear glasses. They think that LASIK is their only way to do that.
Mm-hmm.
Maybe for some people it is. Maybe for some people it isn't. Some people get LASIK and are completely fine. My
Mm-hmm.
best friend had LASIK when we were 19 or 20. She was in medical school, maybe we were a little older, maybe 22. And she was totally fine. And she even says today it's one of the best things she ever
Mm.
done for herself. You know what? Like I'm grateful that she's fine. And I'm so happy that that was not her story. But I see people in the clinic that are really suffering. So there are people that are completely fine. On Google, it says 1% of people are suffering. That's nonsense.
It's like reporting. It's like theirs.
Yeah, it's all exactly,
And
exactly.
people may have other issues. They don't attribute it to their eyes, so
That's
they
the
have no
other thing.
idea.
They have no clue.
Yeah,
So unless you have actual visual issues post LASIK eye surgery, why are you going to report it?
of course.
So we see that the visual issues, visual straight up visual complaints are things like halos, night glares. People will have a lot of dry eyes. That's the number one
Mm-hmm.
complaint. Chronic dry eyes because they're severing the corneal nerve. When you sever the corneal nerve, you're decreasing tear production to the eye. Every single LASIK or PRK surgery. PRK is slightly different, but I'm pretty sure it has the same sort of variables that happen afterwards. So you're automatically signing yourself up for dry eyes. Whether you feel those dry eyes or not, that's a different case. There are things you can do for dry eyes. There's something called a Bruder mask,
Mm-hmm.
and I don't love that one because you have to microwave it, and so like I have it, but I can't use it 'cause I literally don't have a microwave
Me
in my
either.
house anymore. So there's another mask online that's like just heat, and it's you plug it into an electrical outlet, and you get automatic heat coming to your eye, and you kind of press it into your eye, and it will stimulate tear production.
Okay.
And so that's really a powerful thing for people who are struggling with just in general dry eyes or from post LASIK.
Maybe go cut some onions.
Yeah, right?
I mean,
I mean, that's a great
probably
idea.
work.
It would definitely work. It'll sting, but it'll work. But yeah, so those are like visual complaints. And then yeah, people that have actual binocular dysfunction that get LASIK, they will have double vision. They will have their entire world view will be off. And that's why that news anchor killed herself because her entire world was off. She was
Mm.
not herself post LASIK, and I think she killed herself like a month
Yeah.
after, and it was attributed directly to the eye surgery, and it's very, very sad. I've had two patients come in that have been suicidal post LASIK because of the complications they had because they both had visual dysfunction,
Mm-hmm.
actual dysfunction that was underlying that was, not looked at. So that's much more rare, but it does happen. There are support groups like you mentioned. From a PRI like body movement asymmetry perspective, what we see is that because we're overcorrected and because when we're getting that eye prescription, we're usually dominant over one side of our body, we were never put into a neutral place first. The prescription is going to most likely be off, and that prescription is going to pull us more into our pattern, whether it's a more extension pattern or it's a more asymmetrical pattern. We're going to find that LASIK eye surgery will keep us locked up.
Mm.
And so, what I'll see with people is I'll do sessions with them 3, 4, 5 sessions, and they're not making changes.
Mm.
And that's because that LASIK is really overriding everything I'm doing.
Mm.
So until I get them a new prescription, I'm going to be stuck fighting with their eyes. And then what we'll typically do with a new prescription, they'll have to get glasses, which is
Yeah.
literally the reason they
Oh.
got LASIK in the first place. So it's heartbreaking to tell somebody that, hey, you have to get glasses now, but they'll have to get glasses, and usually it'll be a different prescription that maybe has some astigmatism correction or plus.
Yep.
So if they got corrected for distance, they're now going to have a plus correction where it's going to change how they understand space, and it's going to lighten up that distance prescription to make go in the other direction of plus fear.
Got it. Yeah, and I mean, from a light perspective, the cornea has a couple different photoreceptors,
Mm-hmm.
neuropsin and melanopsin, the UVA light detector, and the blue light detector that helps to anchor in the circadian rhythm locally within the tissue, but likely has propagating effects into the brain even. So I mean, we can think about if we're shaving the cornea, we're reducing the total concentration, like the total amount of these receptors available. So now the light signaling that's getting into your eye and into your brain is distorted. It's
Yes.
different. And so I mean, typically what I tell people who already had LASIK is like they should prioritize getting more light in general just to compensate for the lack of like the loss of these receptors. But I think, in combination with the type of work that you're doing, it's a really, really good synergy. And I think we kind of need to do both in order to set them up to
Yeah.
have health in the long term.
Yeah, and some of these people will come in with chronic pain, and it's
Yeah.
like, oh, it started like I'll line it up, and it'll be like, oh, we had LASIK on June 2023, and then like September 2023 is when your hip pain was excruciating, and you couldn't because you couldn't get out of it because before LASIK, if you took your glasses off, then your body could get to neutral,
Yeah.
and you take your glasses off for maybe a few hours a day, even if it was the wrong prescription, you're allowing your body to still have that oscillation. Now that is 24/7 on you.
Yes.
So it's something to really consider before ever, doing. I mean, I think most people that do it that have pain regret it, unfortunately. But there are things you can do. So, seeing a provider that has understanding in this field is really something you have to do. And people will travel when they've had LASIK because those people are quite desperate if they're in pain.
Mm-hmm.
So those
One
are
one thing I was thinking with the glass, is there an issue with wearing glasses and like peripheral vision?
Sometimes glasses actually helps with peripheral vision
Oh,
because the box around your eye allows your brain to sense two hemispheres.
okay.
You have one eye and the other eye. And so for some people, it actually does significantly help.
So glasses shape is then important in some people.
Shape and color of the frame. So the Institute
Mm.
really recommends a dark rim frame.
Oh.
I think that I used to wear clear frames, so it's
Uh-huh.
kind of funny to me because my brain, I just wanted those frames for a reason. I didn't want to know the two hemispheres.
Right.
I don't like black rim frames myself. They drive me crazy. I hate
Hmm.
seeing the frame.
Yeah.
So I think it is person specific. I'm not going to force somebody to do something they hate. I don't like wearing them. I have like a light brown and
Hmm.
they're bigger so they don't bother me. So it is the frame is a piece to it. But you also when you wear contacts, you are going to have more peripheral because yeah, it's not blocking you.
Right, right.
So,
Yeah, that's interesting. I
yeah.
mean, like from an optical flow standpoint, it seems like without glasses is probably better. I
Yeah,
know
I
some
mean,
things
if
are
you don't wear
very,
anything, it's always best.
yeah,
But
of course.
if you wear glasses, it's okay to wear glasses. Like it's not going to limit your peripheral vision. I do think I tell everybody, especially like you with your prescription, we were talking about it earlier, especially if somebody is just straight sphere, like they just have a minus power, like be out of your glasses when you can. Like don't wear them in the morning. Start your day, and unless you need to be in them, don't be in them. But I understand when people have a high prescription, they need to see to get down steps, to do things like that. But I really think that most minus sphere can reverse. A lot of things can reverse. I reversed mine. I don't know what optometrists will say is that that was never my prescription and I was
Of
overcorrected.
course.
But I think that I that was my prescription, and I
Hmm.
think that at that time that's what I corrected as because my body was so stressed out. And now that I've been able to more reground myself, now we see my true prescription.
Hmm.
So I do think that a lot of people can make significant changes to their eyes. There's a book called something about there's an eye book. Uh
About like improving prescription.
yeah, and it
Yeah.
gives you eye exercises you can do.
Cool.
There's certain things. I mean, just looking on the distance
Yes.
throughout your day can help. Being outside more is going to make a significant difference. So I think people have more ability to change their prescription than they ever
I
realize.
agree. I mean, I improved my vision over the past year with just like modulating my light environment by a whole point. So
Yeah,
I
that's
think
huge.
I think I could continue being better with that and like improve it even more. And I feel like with regards to like people not wanting to like go naked-eyed or whatever because of their prescription, I feel like this is just pointing back to like the convenience thing again, where it's like
Yeah,
people just don't want to ever feel even a little bit of discomfort
I
if
was
they
just
can
gonna say
avoid it.
that.
And it's like for me, I just once I normalize just being blind, it doesn't, I'm not even actually that blind, but like, just relatively speaking, it just feels normal at some
Yeah.
point. So like during the spring through fall, when I go on walks, I typically don't wear glasses either or contacts.
Yeah,
And
well,
I'm
and
just,
that's the smartest thing to do.
yeah,
And it does depend also on the person. Like for you specifically, with I saw your script, like that
yeah,
is the best thing for you to do.
yeah.
But like for some people who have more of an astigmatism, it's not always the best idea. So that this one book, which I'll find the title and you can link it. I can't remember at the moment, but he's very much so like everybody should do this. And I do think that some people really do need their glasses to actually get them neutral.
Mm-hmm,
And
mm-hmm.
not having their glasses does make it complicated.
Yeah, that's what I was gonna ask you. Like, is it better to just go without glasses for everybody, or like
Not
sometimes they'll
everyone.
test worse? Yeah,
Yeah,
okay,
sometimes, I mean, most people do test better. Majority of people do test better, but sometimes they'll test worse once we get them the glasses that they need.
right,
So we can test them without anything, and then if I'm at the optometrist with the person, they'll test better with those glasses.
okay, that
Yeah.
makes sense.
So that then it becomes person specific.
Okay, noted. Cataracts.
Cataracts. So what I mentioned before about multifocals, it's like a big thing right now that they push the multifocal lens because they make a lot more money off it, I
Mm,
think. And they think it's convenient for people. But you can't push a multifocal lens on somebody who's never worn a progressive because now you're altering their life view permanently.
mm,
Um, so actually, my mom had cataracts this summer, and I was like in on every single appointment because I was stressed out about it. I was like, you need to make sure you get the right thing, right lens, because she was all confused. She wasn't sure what lens to do. Then I did research. So there's different types of lenses, multifocal. So like I mentioned before, very not ideal for any human. Humans should not have multifocal lenses. I don't care what optometrists say about this. We are not meant to have multiple distances in one eyeball when
mm-hmm,
we are walking through space. And what are we meant to do in life? Walk, breathe, and reproduce,
mm-hmm.
essentially. So multifocal lenses for me are like a no-go. Monofocal, which sounds like monovision, but it's not, can get a little confusing. Monofocal is just to see in the distance. So what they do is they replace the lens of the eye, which I know you can talk about
We're
when
gonna
it
talk
comes
about it.
to
Yeah.
light biology, because it's not optimal at all for
Mm-hmm.
for health and the actual signals you're getting into your brain. But when they replace that lens of the eye, they can replace it with just something for distance vision, and then that person will probably have to wear their readers because at this point what happens is that cataract develops and they're not going to be able to see well in the distance due to the cataracts.
Yeah.
But most of these people are like 60s, 70s, 80s. They probably have already lost up close vision. So they're near focus. So they're wearing reading glasses. So they think that a multifocal is a better idea so that they can see
Mm,
up close well and far away well. But
mm.
I have seen very sad stories post multifocal specifically lens. And I think that it's something that just needs to be educated about. So the monofocal is what I always recommend.
Mm-hmm.
And then you can talk about the components of the light that actually gets through the eye or doesn't.
Yeah, yeah. So it's actually really interesting if you look at who is it? Van Gogh. There was somebody
Oh, I think
else.
it was Van Gogh.
There was Van Gogh and the haystacks painting. Who did that?
I don't know, but I think it's in the MoMA
It's in the MoMA.
because
Yeah,
I
the
was just in the
haystacks.
MoMA and I saw,
Yeah, so
I
was
think
it?
it's Van
It
Gogh.
might be Van Gogh. So it was either Van Gogh or another famous artist from this time period who had cataracts removed, but at the time they didn't have like synthetic lenses to put in. So they just took his cataracts out and left his eyes. And after that period of time, you see his paintings change
Shit,
dramatically because it turns out that we actually have photoreceptors for UV light in our retina. And now he was able to see UV light in the environment. And now he was seeing all
that's
this different
crazy.
dimension of color in the environment. So the haystacks painting has all this different color in it that you wouldn't expect.
Do you
And
think,
people,
did he just take out the lens and not
yeah,
replace it? Oh,
correct.
that's what I'm gonna do if I
Yeah.
ever need to do that.
Yeah, you can totally do that. And another really interesting thing from the time period, there were some studies done with lens removal from cataracts without putting a new lens in, and they saw people's diabetes completely disappear basically over the course of
So
a period
then
of
why don't
time.
we do that in today's
So
society?
there are trade-offs.
I'm sure.
I mean, the our natural lens blocks UV light to a certain extent, not completely.
Oh,
but it
so
does
it's
filter some out.
protective.
So there, yeah, it's probably protective somewhat to the photoreceptors. I mean,
Yeah.
UV photons are higher energy, and so maybe, our retina's not expecting to receive all of that at
Right.
once. It's supposed to receive like a piece of that, but not all of it. And so I guess, there's probably trade-offs there, but it was just interesting to see metabolically speaking how much people's metabolic health improved
Insane.
by letting that UV light into the eye. And especially because in a cataract, a lot of that UV light is being lost even more completely because, the cataract is basically creating opacity.
Yeah.
But now when we're using, different cataract lenses that are available, currently we either have the standard lenses, which block essentially all UV light coming into the eye, UVA and UVB. Probably some UVA still gets through, but UVB is likely totally blocked just based on the material being used. It's not, it doesn't have to be that way. Like we could easily engineer lenses that aren't like this, but this is just the way they're being, developed because UV light has been demonized in optometry and in dermatology, and so, we haven't developed that tech yet, but we easily could do so. So there's the ones that block UV light, and now there's even blue blocking contact or lenses that you can get after what are we,
So cataract surgery.
cataracts, yeah, cataract surgery. And so that's just a giant mess that I can't even begin to describe because blue light's the essential input into the eyes that tells the master clock in the brain what time of day it is.
Yeah.
And so that's what's dictating the circadian rhythm, which dictates every function in our body essentially in all of the organs,
Yeah.
including, sleep and wakefulness, cognition, digestion, metabolism, muscular activity, fat mobilization. And so there's so many aspects to our health that require that blue light input during the day, ideally from full spectrum sun, and then absence of blue light at night. And so the blue blocking cataract lenses are just like absolutely like wouldn't wish them on my worst enemy. Like they should not
God.
exist. The fact that they exist just proves like how dangerous siloing of medicine is because there's no communication here between,
Crazy.
yeah, exactly. So the cataract lenses that block UV, at least they don't block blue, but I really think we need to just develop a technology that's, semi-permeable at least. Like for example, the Dailies Total One contact lenses, they're UV permeable. They don't have UV blocking. They're made of a material that is allowing UV light to come through. We can easily find a material that can do that for cataract lenses as
I'm
well.
sure.
Yeah.
It's funny because when I wore contacts, those are the only ones I ever wore that didn't create problems for me.
Yeah.
I always, they would pop out of my eyes. All the other lenses
Mm,
besides those ones, I used to
interesting.
like always be like, oh, I always have to wear the most expensive
I
because
know,
they're
that's
more
what I felt.
expensive.
Yeah, they are more
But
expensive.
I wore them for almost 15 years, those contacts. So now I was like, I'm so happy that that is
That
what
was
I
the
actually
one.
wore.
Exactly.
Yeah.
On the flip side to that, though, so they're the most expensive contacts, but the UV permeable glasses that you can get are actually cheaper than
No
regular
way.
glasses. So if you go to your eye doctor, I haven't had an issue at America's Best or Lens Crafters. I heard some other people had issues with their eye doctors being dogmatic about it, but if you request CR39 lenses without UV blocking coating on them, they're about 55% UV permeable compared to the polycarbonate, the standard lenses. They're more expensive and they block almost all UV light.
That's crazy.
Yeah.
So it's also really interesting because I've tested patients with and without their glasses that have blue light blocking in them. So
Hmm.
I like the different actual blue light blockers for blue light blocking when it's
Oh,
necessary during
yeah.
the day. But when you are wearing glasses that are blocking blue light all the time, I see it in the clinic.
Yeah.
Their bodies tighten up.
Totally, totally. Yeah, we need that blue light stimulus during the day, ideally with red and infrared light, because midday sun,
Yeah,
it's 25% blue light, but 50% red and infrared. So we're really always meant to receive the short wavelength UV and blue light with an abundance of red and infrared. It creates balance in the system. So if you're under fluorescent lights, LED lights on screens that are unfiltered, that is very much blue light in isolation,
hmm,
no infrared light. That's creating hyper, sympathetic activation, can damage the eyes, can damage the skin, and mitochondrial dysfunction. It basically directly impairs mitochondrial function. So that's the blue light that's a problem. Nature's blue light is, perfect because
it's
it's in
great.
bright ratios.
Of course, everything goes back to nature and what we're meant to be doing. That's how we
Exactly.
heal.
Exactly.
That's
Yeah.
really what it comes down
Usually
to.
the solutions are pretty simple actually when we get down to
And
it.
they're not easily monetized, and that's the
Yes.
crazy part is that the solutions are simple because that's what humans need.
Yes. Yes.
It's wild.
Yeah, I love that. Anything else?
No, I thought this
You're
was
good?
awesome. This was
This
amazing.
was great. Yeah, I think we could
We
probably
covered a lot.
we could, yeah, definitely keep going, but I think we did
I think
good. This is a
we
good, digestible piece of content for people, and we'll probably have to do it again, though, I'm sure.
hopefully different information. I've listened to
Yeah.
a bunch of your episodes,
Oh,
so
yeah. Yeah. This, I think, is a really good diversity, and we'll, keep people interested and wanting to learn
Yeah.
more and then go follow you. And also, hopefully we can record some content later after we start doing our experiments and see what things start to unfold there. I think it should be really exciting.
It'll be really interesting.
So where can people find you?
So I'm mainly my main thing is Instagram, my name, Aleena Kanner. And then my website, I have a platform I put out called Rooted Well. So a lot of these techniques that we talked about here are in there, along with a lot of descriptive videos talking about the components of everything we mentioned here, but in more depth. And yeah, that's mainly where people can find me.
Great. I'll include links to her Instagram, her program, and yeah, so you can get involved in her world and keep learning. And thank you so much, Aleena, for coming on. This was so fun.
Thank you so much for having me.
Long overdue. Thank you guys for listening. Bye.